So you can't, they need to stand over there.
Yeah.
Sheila, can you have them just move over that way? Okay. All right. We are going to call to order the special meeting of the governing board, public hearing at 6:30. Please let the record reflect that Mrs. Fisher, Mrs. Ordway, and Ann O'Brien are here, where Mrs. Paperman and Mrs. Reed are absent at this time. Do I have a motion to adopt the agenda?
Make a motion to adopt the agenda.
I have a motion and a second. All those in favor, please say aye.
Aye.
Aye. Any opposed, say nay. Hearing none, the motion passes unanimously. All right, we are going to go to the public hearing. And for that, I'm going to turn it over to Dr. Gail Galligan. Thank you.
Good evening, President O'Brien, board members, Dr. Finch, and guests. Tonight, we will provide information on House Bill 2862 that amended statutes 15808, 15901, and 151021. It also repealed Section 15861 and added a new statute, 15901.08, which is focused on school instructional time. I'm going to wait to see if we can get that presentation up before I continue. There we go. For the purposes of meeting the instructional time and instructional hours requirement prescribed in ARS 15808 and ARS 15901, a school district governing board, after at least 2 public hearings in the school district, may adopt instructional time models as prescribed in ARS 15901 to meet the minimum annual instructional time and instructional hour requirements. And you can see what was amended, repealed, and added here. Definitions in 15901 have added language which can be seen on this slide for ADM, daily attendance, and instructional hours or instructional time. We will talk further about these changes in upcoming slides, but specifically you can see in the quotation marks what has been added. House Bill 2862 defines a school year as starting July 1st and ending June 30th, with a school month of 20 school days or 4 weeks of 5 days. It requires a school district to receive approval from its governing board through at least 2 public hearings in order to adopt the ITM or instructional time model. In addition, 15901.08 allows local education agencies or school districts to adopt instructional time models to provide flexibility in how instructional hour requirements are met. It also specifies that LEAs define specific attendance procedures for instruction that will take place outside of an in-person classroom. House Bill 2862 allows local education agencies to adopt instructional time models to provide flexibility in how instructional hour requirements are met. Instructional hours may be delivered in any day, week, or course length increments. It may include in-person or remote instruction and allows LEAs to meet hours through different modes of instruction, as you see here, such as in-person instruction, remote instruction, project-based learning, mastery-based learning, and weekend evening courses. To offer remote learning in the upcoming school year, or in the school year we're currently in, LEAs must have an approved AOI, Arizona Online Instruction, or an adopted ITM, instructional time model. Deer Valley has Aspire, which is our K-12 online academy. On the next 2 slides, we will showcase the instructional time models Deer Valley proposes for the 21-22 school year. What you see here are the traditional learning options in Deer Valley. We'll first talk about developmental preschool. That is in-person on identified Deer Valley campuses. For elementary schools, that is our K-6, K-8, we have in-person on campuses and our synchronous online instruction enrolled for students in the Aspire Online Academy. For secondary, which is 7-12, in-person instruction on our campuses, in-person at Pathways, which is our afternoon and evening program, synchronous and asynchronous middle school enrolled at Aspire Online School, and asynchronous high school enrolled at Aspire Online School. On this slide, we have two instructional options that are outside of the traditional instruction that we just saw on the previous slide. What you see in number 4 would occur if or when a statewide closure of schools may occur. Students will be given the option to attend live classroom instruction through a virtual meeting, which for us would be Zoom. In number 5, we address unique situations that may arise for both synchronous and in-person instruction. So for example, in A, synchronous instruction may be provided for students who have an IEP with many minutes that are required. For B, synchronous instruction may be provided when significant increases in COVID-19 community transmission levels occur. That could be when we were to close a classroom or close a school. C, synchronous instruction may be provided when inclement weather or transportation limitations occur, preventing in-person instruction. We've had this happen to us in the past when we've had major washouts up in the New River area, and buses have not been able to pick up children or to get them to school. And D, instruction may be provided to resolve scheduling conflicts outside of the school week, including synchronous options. This would be for a situation where a child couldn't get what they needed in their schedule during the school day, and we were able to provide a unique situation and opportunity for them. A significant part of 2862 is how we will attract attendance. For us, our traditional learning models that you saw on the 2 slides ago, Power School is used to mark in-person attendance, and My Hours is used for Aspire Online Academy students. Both are our normal attendance tracking systems, and we have great experience with both. Participation in remote instruction will be reported at the student level through the 2 new attendance descriptors you see here. And we've been given those descriptors from ADE this year. If a distance learning situations were to occur, students will be reported as in attendance if they attend the virtual meeting and absent if they do not. For any other unique situations, we will identify the criteria for being marked as present or absent in each day. School finance will use the reported student-level data to calculate the percentage of instruction that is remote at the school level. We will have our second public hearing on September 14th before the board meeting and bring back the Deer Valley's instructional time model as an action item at the board meeting. That concludes this presentation.
Thank you, Dr. Galligan. At this time, did you have a question, Mrs. Fisher? No. Okay, we can come back. At this time, if there is a member of the public who wishes to speak specifically to the presentation, then we would take those comments at this time, but it must be on the instructional time model only. All right. Hearing none, I will turn to board members. Mrs. Ordway.
Dr. Galligan, that was a very detailed and complete plan. Glad that you've planned for what could happen. Does that affect the homebound minutes at all, or is that a completely separate meeting count?
President O'Brien and Ms. Ordway, that would be encapsulated in what we are proposing already. Those students receive either instruction at home with a Deer Valley teacher in person or at Vista Peak for the most part. So what we have proposed would cover our homebound students.
Thank you.
Mrs. Fisher.
I would like, if we could in the future, get a little bit more information regarding the instruction time for our students. During the shutdown, when students were home, a lot of students, especially on IEPs, services fell extremely short. There's just an additional need for supports in that area. And I think I would like to see a little bit more detail in what we are proposing, if for no other reason than for the security of our parents, to understand that their children will truly be respected and honored regardless of their differences.
President O'Brien, Ms. Fisher, I missed the very first thing you said. I would imagine this is for our students who are on an IEP?
Correct.
Okay, thank you very much.
All right, seeing no more questions and no public comment, then I would accept a motion to adjourn our public hearing.
I make a motion to adjourn this meeting at 6:40.
I second.
All those in favor, please say aye.
Aye.
Aye. Any opposed? Hearing none, the motion passes unanimously. We'll be adjourned until the meeting, regular meeting starts at 7 p.m. If you wish to speak during that meeting, you need to fill out the yellow public comment form that's out in the lobby and turn it into our lovely Mrs. Taylor here to my left. Thank you. All right, I'd like to call the regular governing board meeting to order at 7 p.m. Let the record reflect that all board members are here except for Mrs. Paperman. And then if you would join me in the Pledge of Allegiance, followed by a moment of silence, I would appreciate it. Thank you. Can we have a motion to adopt the agenda?
I would make a motion that we adopt the agenda.
I second.
All those in favor, please say aye.
Aye.
Aye. Any opposed? Hearing none, the motion passes unanimously. Our first order of business is our Safe and Healthy Schools report, and that is Dr. Zerbach.
Okay, good evening, President O'Brien, members of the board, Dr. Finch. This evening, we are bringing back our COVID-19 school update report. It will now be known as the Safe and Healthy Schools Report. This new name also aligns to the language that is being used by ADE.
Look at me.
Okay, I will not read all of the topics here, but I'll pause just for a moment so folks can see the topics that we're going to cover in the next slides. Okay, so we're going to begin with a very, not even 40,000, this is like a 200,000 foot overview timeline of where we began and where we are now. As you can see in the first line, in March 2020, that is when the governor ordered our schools to transition to virtual due to the COVID-19 pandemic. In September, and we remained in virtual through August of 2020. In September 2020, we did begin to phase in our students back to school. If you recall, we had certain cohorts of students at various grade levels enter in, and that usually varied and rotated on a week-by-week schedule. Throughout the spring and summer of 2021, there was a multi-department effort led by Dr. Galligan to establish our full K-12 online school, which is known as Aspire. And in the summer of 2021, we also had some additional points that are worth mentioning. The first is 15.34205, which stated that schools cannot mandate mask usage nor vaccines as a condition of attending school. Now, that particular item has an asterisk because, as we know, recently that was challenged by Phoenix Union, and in the preliminary ruling by the judge ruled that that was not enforceable until September 29th. Also in the summer, DVUSD established a 2021-22 safety plan, and that friendly URL is listed there, and we'll be going over that in detail in a moment. August 2nd, DVUSD, our school year begins, and then on August 12th is when Maricopa County Department of Public Health informs DVUSD that the quarantine is. Okay, so the next several slides are going to have some various statistical descriptive statistics about levels of COVID-19 in our community. Before we hit some of those slides, just a quick introduction in terms of the Delta variant, because if you have not been paying attention to the news, which most folks have, you would know that 90% of our cases right now in the county area are being attributed to the Delta variant, or as the slide says, a subset of that particular variant. This variant, public health tells us, is anywhere from 2 to 3 times more contagious. And we are also being told by county health that cases are predicted to stay high until mid-September, when it may start declining. And if you are wondering how they are coming up with those predictions, they are looking at levels of COVID when the Delta variant is the primary strand in other countries and other areas that have already experienced the Delta variant. And so in those cases, they see about an 8 to 10 week surge for those cases, and then they look to see that those numbers start to come down for the Delta variant. Okay, this is a this is a slide that we're very familiar with as we have presented the past year and a half. This information comes to us from ADHS and Maricopa County Department of Public Health. This is specific to our district, so we call this the community level of transmission metrics. And you can see that we are in the high threshold, which is greater than 100 cases. And so our data points are below, and so that is a weekly count, and you can see we have been on a steady rise. As for our rate of positivity, you can see that again, we are in the high threshold or high transmission category for this. The numbers have started to come down somewhat from where they were a couple of weeks ago, and this is likely due to increased numbers of persons that are going to get COVID testing. As far as our zip code data, you can see here, these are our zip codes to which our schools are located in, and our case counts are all in the high transmission. EpiCurve, I have not shown this as much in prior presentations. We've featured it a couple of times. This here you can see going all the way back to the start of last school year, how the case count climbed and fell throughout the course of the year. And so you can also see from the start of this school year what the curve has been in terms of the increase. The most recent bars that you see there, those usually get populated a couple days out, so it's more than what those are. And so folks can check that out. That's on the Maricopa County Department of Public Health website, and any person can go in and see this. This is one that is lesser known, and this is our age count. And so when you go into the county database, you can select something called the age group distribution. And so in here, this features our students ages 6 through 12, and also our students ages 13 through 18. So of course, these are predominantly the students that make up Deer Valley's student population. And so you can see again here that the numbers are on a steady rise since the start of the school year. As far as our DVUSD dashboard, this is something that we started publishing again yesterday. If you recall, in our webinar that Dr. Galligan and I did in July, we explained to the community that our stakeholder group, which was composed of members from our staff and also our parent community, that group had recommended we not do the dashboard. The dashboard was something that we came out with last year to meet the need that was being voiced by some of the members of our community. What we did see, though, is that what Maricopa County said would happen, happened. Maricopa County had told us that it is likely this would cause confusion for folks who don't understand all the ins and outs of the case counts with COVID-19. Excuse me. And so sometimes there was some chatter from the community as far as whether the dashboard was accurate or not. And that was one of the reasons that the stakeholder group had recommended that it not continue in the 21-22 year. However, since we have started school, we've had a number of stakeholders, both staff and parents, that have voiced to us that they wanted to see the dashboard return. And so we published that dashboard yesterday. That dashboard contained our active cases for the past 3 weeks. We'll continue to publish that as we move forward in the future. And the very friendly URL is at the top, dvusd.org/dashboard. Okay, as far as our outbreaks from the county, again, the outbreak is an unfortunate term that is used, and we've stated that from the start. But what it means is if there are 2 cases in a school, when one of those cases was most likely transmitted within the school. When that happens, county deems that there is an outbreak. Now, that transmission from one person to another could be from a student to another student. It could be from a student to a staff member. It could be from a staff member to a student, or it could be from a staff member to another staff. So if that occurs in any of those four situations, then county would call us, and sometimes it is delayed, as we have found out throughout last year and already into this school year. They notify us, they tell us that you do indeed have an outbreak. They sometimes give us a little bit more information about that. Sometimes they do not. When they notify us of this outbreak, we are required by an executive order and an emergency order from ADHS to notify the community. And the community is defined as the staff population as well as the population. That letter for many of our parents is a letter that they know because they've already received it here. And you can see on this slide, we have listed the schools that have been deemed by Maricopa County to have an outbreak so far in 21-22. Okay, as far as our COVID testing opportunities, the district is wanting to support the community with these opportunities. While they were very plentiful in the summer and in the spring of last year, it is less plentiful now. It is, in other words, it is more difficult to find a test. It's not as easy as going onto the Walgreens or CVS website anymore. Sometimes it can be booked out for several days. And so because of that, since the start of the school year, we did work with Maricopa County to partner with a vendor. And so that vendor is here on Tuesdays and Fridays, and that's right here in the district parking lot. And they do it at least from 11 to 2. Sometimes it continues on up until 5 p.m. It depends how many tests they are able to bring and that they can do. Binax Now is another option that we have. That's a home testing option that has been getting increased usage in the past 3 weeks, whereas we saw very few of those in the summer. Again, we are now starting to see more of those. County has provided about just under 1,000 tests for us with the Binax Now. You can imagine that that is a test that is in high demand, and so supply is somewhat limited for that. With those, or I should say with that first shipment to us by county, we are focusing those for the use from human resources so that our staff members have quick access to a test. And the reason for that is quite simple, is that we need our staff members to be in the classrooms so that we can have appropriate staffing levels in our schools. If there's not enough teachers or other staff members in our school, it makes it very challenging for us. We do hope to expand the use of the Binax Now test along with other home testing kits that are approved by Maricopa County in the very near future. My colleague to my left, Ms. Heather Mock, and I have been working together, again, along with county to procure a large number of these tests that are in high demand so that the schools can have some as well. And then the schools can use these to meet some of the student demand for the testing. So that's one piece of the expansion. The other piece to that expansion would be here at our district office. As I noted, the Tuesday and Fridays that are currently happening, we are looking to expand with our current partner by at least 1 day a week. And we are also looking to have a dedicated lane that would be for our DVUSD students, so they would not have to wait in what is sometimes a long wait. We have heard that some students and some staff members have had to wait at least 90 minutes and even some cases 2 hours because the line is quite long from the community. And so we're working on that dedicated line for our students and our staff. And we're looking for that third day, as I mentioned. We are also looking at another vendor that would possibly be able to do it with us on the 2 other days of the week that we would not be partnering with our county partner. And so that is in preliminary talks right now, but we are looking to make some final decisions on that very soon. And again, we have a very friendly user URL for that, the dvusd.org/COVID testing. On that website, parents and staff members can see what the opportunities are to get a convenient COVID-19 test. Okay, face masks and school busing. This is something that we know has drawn quite a bit of attention from the community. Masks are required on our school buses. This is due to a federal order for the Centers for Disease Control. And at this time, this order has no expiration date, but we will continue to monitor it, and we will keep the community apprised of any future changes to this. Okay, this next slide contains many of the tools that we have in our safety plan. What we sometimes hear from a community member is that DVUSD does not do anything to mitigate or prevent COVID, and that is just not a correct statement. This slide here contains, again, many tools that we are utilizing in order to mitigate against it, and so I would like to take a moment to review some of these tools. The first one that we use is the requirement through state statute and the administrative code that county is mandating us to do, and that is the use of the quarantine. And we also have sick policies for our staff and our student. For our students, we discourage our perfect attendance policies, and so that is one method that we use to help dissuade parents and students from sending a child to school sick. And then with our staff members, Ms. Moffitt, I was thinking you could jump on just for a second and explain the bank of days that you came to the board with probably about a month ago as far as extending the 10 days and how that helps as far as, again, serving as a motivator for folks to not come to work when sick.
So just recently, I believe 2 governing board meetings ago, the governing board approved the extension of 19 leave that was FFCRA leave that was federally funded that expired December of 2020. The board adopted a COVID-19 leave, which extended those 10 days for our employees who had not already used it for the purposes of quarantine and isolation. As the board is aware, but perhaps the audience is not, we do function under essential worker guidance, but still under that guidance, quarantine and isolation is still sometimes necessary. If they haven't used the 10 days, they would qualify for coverage, payment coverage for an additional 10 days beyond their leave time that they are granted through our leave policies.
Thank you, Mrs. Moffitt. To continue on, we use our enhanced air quality and ventilation measures. Most folks are aware that we do have our HEPA filters, which are located in just about every room throughout our district. We do continue to do things such as purging the air in the mornings in our school buildings. Our third piece, making parents aware of vaccine opportunities. So for those parents that read our parent updates, even as recent as yesterday, we included information for our parents as we have an upcoming COVID-19 vaccine opportunity, as well as other vaccination opportunities at Constitution Elementary. I believe it's coming up at the end of this week. And we have been doing that throughout the summer in terms of making our parents aware. We also continue with our enhanced cleaning and disinfection. We have our enhanced hygiene that comes through our hand sanitization features throughout the campus, and those are quite numerous. We also engage in case cluster monitoring. This is something that is outlined in the Maricopa County procedures for us in terms of managing COVID. And so that primarily occurs through the ALS department. So between Ms. Frank and I and other members of the team as well, that when a school alerts us to a potential cluster, we will many times get on the phone with that particular administrator and we will talk through the case cluster and then make any adjustments that we need to do moving forward for that. We also have our frequent parent communication, as I alluded to, with our vaccine opportunities. In those parent communications, we communicate how parents should report COVID-19 measures to us, and we also communicate other important aspects of COVID-19 with our schools. Continuing on the right side, we have continued with limitations on visitors and volunteers, and the primary reason for that is that, as you know, adults are still the primary group that is transmitting COVID. And so because of that, we look to put those limitations, and that's a very common measure that is being used by school districts all over. We have lunchroom measures which are still in place. So in our K-6 and K-8 schools, most of our cafeterias are large enough where the students can face one way. We have our optional mask provision, which we always state in our parent letters as well. We have our face masks on buses, which I mentioned in a previous slide. We provide N95s for our nurses. And we also do the outbreak notification to our families, which I talked about before. And of course, the optional vaccination information, which we talked about. Okay, the next slide is current CDC guidance on mask usage. CDC does recommend at this time, that changed fairly recently in the past couple weeks, as far as universal mask usage for students and staff when they are indoors. And that recommendation from the CDC is for both vaccinated and unvaccinated individuals. Okay, this is a very important slide. This is the impact on our operations. And we alluded to some of this in a parent communication on August the 15th. So I will go through this slide in detail. So the first piece is that we have had approximately 150 positive COVID cases transmitted at school during the first 3 weeks of operation. Our second point is that we have had about 4,441 students quarantined. That number is probably actually higher because many of our schools filled that out on Friday, as I needed to give them some time to do that. We know how busy they are. And so given the past 2 days, that number has likely grown well above 5,000 at this point. We also have had a very large number of students who have been sent home from school due to illness. This is very problematic when this happens in our schools, quite challenging. And so we have had situations that you are aware of where even parents have sent their child to school with a known COVID positive test. And again, when that happens, we do see clusters of COVID pop up quite quickly where the student is seated. We also have 12 classrooms that were converted to virtual so far, and that is due to the case cluster monitoring and or it was due to the inability to staff that particular room. The next slide captures the magic that our administrators have been doing, and so you can see that the adjustments that they have had to do on the fly, that they have been many. And that is not only the school administrators, but that's members that are at the table here and in the audience. And so our Mrs. Moffett, Dr. Galligan, Polichunas, who's here in the audience as well, that with their staff members, they also help deploy out to the schools to help cover some of the classroom vacancies that are occurring. And so you can see here that it is a number of times that our administrators have had to make some adjustments right on the fly in order to keep the in-person operations going. We have had about 25% of our schools in the first 3 weeks have had to make adjustments in the health office because the nurse or the nurse clerk was not able to be there due to a COVID reason. And then we've also had greater than 25% of our campuses where a campus admin has been out of office in the first 3 weeks due to a COVID-related reason. And so the primary purpose of this slide is to give facts to both the board and the community as far as how COVID has impacted the operations and on our 39 campuses, and also relate to Aspire as well. Okay, as far as quarantine, again, we are well aware that this is something that is quite controversial in the community. This is a requirement from Maricopa County Department of Public Health. We have communicated this requirement various times in our parent communications. The ARS statutes are included here, as well as the Arizona Administrative Code. Those statutes and the code are included in the county letter that is provided to the parents, which outlines what the students must do when they are in close contact with someone who is COVID-19 positive during the infectious period. Who is not subject to quarantine at this time? The Centers for Disease Control and Maricopa County Department of Public Health, along with Arizona Department of Health Services, provide 3 provisions, if you will, for an exception to quarantine. Fully vaccinated students are not subject to quarantine. Also, when students and staff are consistently and correctly wearing a mask, they are not subject to quarantine. That one is tricky though, because as it says in the last line of that bullet point, it means that both the individual who tested positive and then any close contacts both need to be wearing that mask. And then the third provision, which has been with us for quite some time, and so this is probably not new to you, is that someone who has tested positive for COVID has a 90-day window where they are immune, if you will, from a close contact from a positive case exposure. And then in all three of these situations, as indicated below, the student needs to be asymptomatic in order to return and take advantage of that provision. So quarantine is complicated. That's why I put it right there in big letters. I know that there is much chatter in social media and in other forums about how the schools determine the quarantine and why do some folks get 6 days and other folks get 10 days and some folks get 2 days. And so I just put a few items here that it depends on a number of factors. Again, it can depend on the vaccination status. It also depends on when we receive that positive test result. Sometimes there is a delay. When there is a delay, then it can change the number of days. It also depends on the date of the most recent exposure to that COVID-19 positive individual. And then also the early release provision is one that can change the number of days. And so again, due to these factors, the date range can vary. With our athletics, this is something that we have been monitoring quite closely because we know how much our student athletes are looking forward to their athletic season, and this also pertains to our fine arts communities as well, as many of them compete just as much as any of our student athletes do. We did have a district communication out to our 7-12 parent population, communicating some of the important concerns related to COVID-19. As far as our operations, we have had a few teams that we've needed to put a pause on so far, or a temporary pause, I should say, due to a COVID-19 case cluster on that particular squad. Okay, and with that, I am going to pass the baton to Mrs. Jenna Moffitt. Jenna.
Thank you, Dr. Z. All right, Governing Board President O'Brien, Governing Board members, and guests, we're going to review a few things in human resources related to the upstart of the year, including the impact of COVID. First off, I want to share that we indeed, as we have over the last few years, been dealing with vacancies. This is not unique to the Deer Valley Unified School District. It is an issue, as you know, that we do face in the state of Arizona. And we do collect information regarding vacancies across the state, and we'll be sharing that with you soon after we're done with our ASPA survey in the next couple of weeks. We have more vacancies, additional vacancies that you see at that final bullet there, certified and classified positions. They can be seen at jobs.dvusd.org or careers.dvusd.org. What I highlighted for you were the three most common areas of interest. So currently we do have 66 certified classroom postings. Not that we don't have additional certified postings beyond this, but these would be classroom teachers, the majority of those being in special education. 66 certified postings represents both full and partial FTE vacancies. We also have 29 custodial and plant foreman positions that are currently available across our system. Only 5 of those are currently covered by our contract agency, who we have been working with now well over a year, and who has also struggled in finding custodians to support us in both of those types of positions. And then we do need 25 bus drivers. We probably could survive with less to be able to run all routes and not have to double up. I know that they would appreciate anywhere up to 50 in order to run all athletic routes and so on, but around 25 is what would really help us be more efficient in the transportation department. You can move to the next slide. So a COVID update specifically to staff. Dr. Z covered students. We have had up to about 8:30 this morning, 588 cases have been managed over the last 3 weeks since the first student day of August 2nd. 90 employees have been positive since the first student day. 31 employees are currently actively positive right now at this time. And 49 employees currently at this time are either in isolation or quarantine waiting for their COVID results. So as you can imagine, that certainly is an additional staffing implication beyond the slide I shared with you before. We are working very hard to cover not only these types of needs, but the vacancies that you did see on the previous slide. We utilize campus-based coverage options, and our staff certainly is working very hard to manage this on a day-to-day basis. Different district staff members do deploy. We have not had to deploy district staff the last 2 days, but prior to these last 2 days, we have deployed every single day out of Human Resources, out of Gail's department, and also out of Paula's department. And then we also are utilizing contracted agencies to help us on both the certified and classified sides. And as Gary mentioned, we also have begun to use the Binex tests, COVID tests. We either visit the site where we know some of our employees may have been impacted by COVID. If we can test them at that point in time and get them back to work at that point in time, that's very, very helpful. Or if an employee can meet me here at the district office, that also has been helpful to get them back to work faster. But again, we're waiting for more assessment, more of those tests to arrive. We can go to the next slide. We are recruiting always to hire more staff to cover all of these needs that I shared with everybody. Specifically, we are going to be sharing with our parent organization next week, perhaps they can help us in marketing, that we are looking for health office workers. We know that we have so many parents in our system and community members in our system that work right now as LPNs, as RNs, as paramedics, as EMT, perhaps they're on the fire department, and there are days where they're not working and might want to help at their child's school for an hour or two. And if we can employ them as temporary workers and certified substitutes in the health office, they either can, as LPNs and RNs, work in lieu of the nurse when the nurse is out or needs to go do something else. And if other licensed in a different way can assist the nurse in the nurse's office with so many needs that we have right now at all of our campuses. We also are going to be hosting another job fair coming up in September to recruit for all open positions, and adding an additional online job fair soon to follow. That's it. I think that's an extra slide, actually. We'll just skip that slide.
Thank you, Ms. Moffitt. Dr. Galligan?
Thank you very much. This slide here just shares what we are providing when we have students who are out with COVID absences or quarantines. This is the same information we shared last May through the summer with our administrators and our staff. When students are absent for that documented COVID-related reason, they will be able to utilize their Canvas courses and have specific check-ins with teachers. As you can see at K6, teachers have the opportunity to have that curricular support in their Canvas course, and then teachers are reaching out for 2 check-ins. What I will say is if a parent notices that that is not the case, to first please reach out to the teacher, and then only after you've talked with the teacher or you've not been able to reach the teacher, please reach out to your campus principal or assistant principal, and they'll work with you so that we can ensure that while children are out for COVID-related reasons, that they can be taken care of. For 712, students have the opportunity again through Canvas and or scheduling an appointment or office hour with the teacher. Again, I would encourage parents to reach out to the teacher first if you are struggling or your student isn't able to have that access through Canvas, or scheduled an appointment with the teacher, and after you've reached out to the teacher or you've not been able to receive anything back in a timely manner, reach out to your principal or your assistant principal. What I would like to say is that we know that when children are out and not at school in person, that it is a bit more challenging for them academically. That's why we have made a significant effort last year and this year to build Canvas courses with our own content, board-adopted resources, our own videos, our own lessons with our teachers. So with that said, the check-ins that are to be happening, we are working, and this is from our campus administrators, to be proactive and set structures for students and parents as much as possible to know how to access learning when their child is either quarantined or out for COVID. We know that our campuses and our teachers use Canvas messaging, Blackboard text and messages, Zoom in some situations, Class Dojo. Our schools are using the programs that work for whatever grade level or grade band works for them. We know that this is most challenging for our youngest learners and that our primary teachers work so very hard to make sure that their children receive something while they are out. The challenges, and the last one is identifying how to meet each unique quarantine or isolation situation, and that is very similar to what we put in place last spring. Each children's need and each children's time out is very different, and so working with our parents so that we can meet the needs as best we can for that particular situation. The challenges include that, as Dr. Zerbach and Ms. Moffett mentioned, in some cases the volume is so significant. It is difficult to manage check-ins. And we know that that is happening, and we ask that you be patient with us as we work our way through this, because it's another new, unique situation for us in education. We also have teachers without preps. As you heard Ms. Moffett say, we do not have all of our staff members covered. And so that means many of our teachers at the secondary level may be teaching through their prep, or there may be situations where they don't receive their prep because they are supporting other needs on campus. And that causes a challenge when we are asking them to check in with their students. Group meetings are hard and not effective for younger grades. As I mentioned, our younger children, kindergarten, first, second, even up into third grade, it is very difficult for them. I will say that our teachers do their very best, and we learned an absolute boatload last school year, but group meetings are just hard when we think about it. Another challenge, and this is not necessarily across all of our schools, but it is across our schools, is that some of our families have not picked up the technology for Canvas and check-in usage at home. And so that makes it very challenging when we provided the opportunity for devices and other resources for children to access their learning. And then you'll notice that the last bullet is the same in challenges as it was in check-ins. Identifying how to meet each unique quarantine or isolation situation when the magnitude in some of our schools is so great. We again just ask that our families be patient with us, and if you know anything about teachers in Deer Valley, you know that they are professional and they care deeply about student learning. What I will say at the very bottom is that something that we were able to do last year at high school and in certain other areas, that in-person and online teaching at the same time, it simply was not effective, and it is definitely not sustainable, and we are not moving forward in that direction at this time. Thank you.
Thank you, Dr. Galligan. And the last item that I wanted to bring up before we get to questions is just one additional point related to Mrs. Moffitt's earlier bullet on recruiting for our health offices for that support. That one additional piece we are doing as well is using some of our ESSER funds to increase our full-time support with our nurses. And so that is something that we began posting fairly recently, both for the high school level and then for some roaming full-time health support folks, as our nurses continue to be heroes in our system. And so we are looking to find ways, both in the ways that Jenna mentioned and then the one that I just mentioned as well, to help provide them some relief with this. And so with that, we will entertain any questions you may have. Thank you.
Thank you, Dr. Zerbach, Dr. Galligan. Mrs. Moffett? Mrs. Fisher?
I have a lot of them, so if we could just do one, and I'll do one and give a chance and then come back if we can do it that way. In order to make this question make a little bit of sense to you, I'm going to have to give you a little bit of data. When I start looking at what you provided, it's similar to what we've been provided and what the CDC provides and what the news provides. But as I look at this, I'm a little concerned because I'm wondering what data we're not looking at. It's been, 18 months that we've been going through this, roughly 17 months. And when I First, I want to say that the CDC is not a law-making body. It is not a rule-making body. They have provided guidelines for us, and they've provided guidelines for everyone. But they are guidelines. They are not rules. They are not laws. So that's number one. However, they do seem to be the place that everybody wants us to take our information from. And so because of that, I decided to look. When we're discussing masking our children or masking our employees, it's really important that we understand what we are doing. I'm not sure if anyone is aware, but on May 21st of 2021, the CDC released an additional report stating that there is no significant impact on schools, classrooms where masks were and were not present. This can be found on the CDC's website, of course. I will go ahead and send you that link as well. But in looking at the CDC website, one of the things that I look at is the death rate. The loss of one child is too many. And in this past year, total from all, this 2021, 2020, 2021, there were, from age 0 to 17, there were 53,193 children in that age group that died. I can tell you that of those children who died, only 361, and that's still, any one is a big deal, but 361 had anything COVID related. The greater concern is that 865 died from bacterial pneumonia. Okay? If I take a look at the prior year, of course, there was not COVID. So when I look at the 18-19 year, there was not COVID. And it was a really weird year because we only lost 14,000 students, significantly less. In the prior years, it was double that. So I'm not really sure what happened with 18-19, but it was significantly less. Either way, in the 18-19 year, we lost 298 students to bacterial pneumonia. So that tells me that in last year, when we had our children masked, our rate of children dying of pneumonia increased threefold, 300% increase. That is significant. And then when I look at kids who died with COVID and pneumonia, or COVID and the flu, pretty much every kid who died of COVID also had pneumonia and the flu. So COVID is not a significant taker of our children's lives, but something took 53,000 children's lives. And unfortunately, the CDC is not providing information on our suicide rates, the rates of accidents, the rates of murders, the rates of, so those aren't in there. So the question, my first question, and we'll get back to the others, is when we are looking at the potential for masking children, are we looking at all these other rates? Because when we have children that are masked up but are still getting the same rate of COVID infection and 3 times the amount of pneumonia, of which we've lost a significant portion, is that a factor that we are considering in our mitigation? Because we have to look at the whole picture for our kids and for our staff. So I would like to know, are we looking at other data, or are we only looking at what is provided specifically packaged pretty for the media and for whomever about COVID?
I can answer that.
Dr. Finch?
Just, are you aware that it's masks optional in Deer Valley? Did you miss that part?
Dr. Finch, I didn't say it wasn't. What I said was, when we are considering decisions, are we looking at all these factors? That's what I asked.
Of course we do. Yeah, we do.
Okay. Mrs. Reed?
Thank you for all of the information
Dr. Z. I know that there has been quite a bit of frustration about the timeline from when a student was exposed to a COVID positive case to the time that they're notified about quarantine. And I know that some of that is not district controlled, but once the district is notified, either by the parent or by county health, can you tell us how long the turnaround time is, or the expectation of the turnaround time from the time that administration finds out to the time that they notify parents, when it is in our control, how long that is?
Sure, President O'Brien, Ms. Reed. So I'll answer what I think you're asking, and you can tell me if there's more to it. So once a school or the district is given notice of a positive test, we do look to get confirmation for that. And so we look to see the diagnosis, if it's from a lab or for a home test, we do need to see the confirmation of the test. And then the administration and the nurses, they start their reporting process. Maricopa County has a automated process that they use, and so that information is uploaded into their system. And so that usually happens on the same day once we find out about it. And so the only times it really wouldn't happen on the same day is if it comes in through the district tool, say in the evening after school hours have concluded, that we would provide that information to the school. Sometimes the school administrators might act on that if it's late in the evening. It depends on their schedules, but most of the time, if it's after hours, they would act on that in the next day in the morning. And then as I said, the information is usually processed that same day, and then those letters, we are mandated to provide those from county to the close contacts, and those letters usually from most campuses are sent towards the end of the day.
So roughly, depending on the day of the week, right? Obviously, because the districts is closed over the weekend, but so usually that's happening within 24 hours.
Correct.
Is that correct? Okay, so the lag time then from a time that we have a COVID positive case to the time that we're notified isn't necessarily the district's fault. Once we are getting it, then we are turning around as quickly as possible and notifying, correct?
That is correct.
Okay. Is that written somewhere in our mitigation plan or on our website that we will send those letters out within 24 hours or by the end of the next school day?
As far as the exact timeline, I don't know. That's a positive presupposition we have with the community, that when we find out about a test, that we do not sit on it and wait to notify folks, that we do take action quite promptly.
If it's not on there, I would recommend that we put the timeline on there of when we are notified and then when we turn around and notify. I think that would be helpful to the community. Thank you.
Thank you.
Just one second. And to Mrs. Reed's point, Dr. Zerbach, and I apologize if you already have this out there, but I do think it's important to additionally reiterate that the school district's process is completely and totally dependent upon a parent reporting it to us. So if an exposure occurs on the 20th of August, but the parent doesn't report it to us till the 25th, that we can't do anything about that. So I think that there is also additional confusion from parents about that whole reporting process and exposure timing. And so I don't know if we communicate that as well in our letters, but I do think it's important for folks to understand that.
We can do that, President O'Brien. For the most part, the way you described it is true. County does inform us of test as well, but as we know, it's a commonly known piece that is always not super timely from county when they make us aware. But they do make us aware of those tests later on if a parent does not report it to us. But for the most part, you're correct, and we can emphasize that point, that our continuity of operations in terms of in-person schooling does depend on a partnership with the community to report in a timely manner.
Wonderful. Thank you so much, Dr. Zerbach. Mrs. Ordway?
To that point, too, if someone takes a home test that comes out positive, there is no way to track that, correct?
President O'Brien, Ms. Ordway, there's no way to track it from the standpoint of the county knowing about it?
Correct.
That would be correct. So for us, a parent reports that to us when they use a home test, or in the case of the staff of Mrs. Moffett, the staff member would be required to show us that if they took that at home, but many times, as Ms. Moffett described, that is actually on site where we can see the test.
Yes, for the employee, but not for the student. So
Correct.
we have had,
The home test, just so to make sure the community is aware that home test, it is an approved piece from Maricopa County Department of Public Health in terms of testing.
yes, it's only useful if the positive, if it were to come out positive, if that's reported to someone, because if it's not reported, it's not useful, correct?
Correct.
If we don't
would
know,
need
we
to,
don't
we
know.
need to have the information from the community in order to take action. That is correct.
Okay, and then, so with the bus and the transportation, there's been a lot of talk about that, that we don't have to follow the rule. However, at the bottom, I think, at the very bottom of the order, it does say that we're to follow CDC and I think state or county health rules, correct? In the beginning of it, it says that school buses are exempt, and then at the very bottom, which is a piece that many have not looked at, it does say that we are required to follow the CDC guidelines.
Sure. President O'Brien, Ms. Ordway, I do know what you're referring to. So those are two separate orders. You're referring to the TSA, so the Transportation Security Administration's order. We are under the CDC's federal order, and I know that Ms. Fisher had brought that up earlier. And as far as that order, that is mandated. That is from ADE on their website that it's mandated. Legal counsel has also weighed in on that, that is a mandate that we must follow or we do risk federal funding for that.
Thank you, Mrs. Ordway. We'll circle back and start with Mrs. Fisher.
Well, I was going to do quarantining, but we jumped into bus, so I'll do quarantine.
Sure.
When you look at the federal transportation, buses are excluded. And this is what I said at the last meeting, buses are excluded. And it says that you should look at the CDC order. When you go to the CDC order, it says that you should refer to the Department of Education for guidelines. In the Department of Education guidelines, it says these are not enforceable by law, that they are recommendations. So if the district wishes to continue to mask on buses by force or what have you, we just need to make sure that we're being transparent and honest, that that's not the path of, there's not something that is, there's not a law or a governance that is saying we must do this. It's a choice. And that's all I'm asking for is transparency, that this is a choice and a decision that's being made.
Sure,
It's
and
not required by law.
for the transparency, there is an FAQ document on the CDC's order, which states, are buses required, school busing, do they fall under this mass transit order? And it says very clearly that yes, school buses fall under this and are required to do so.
But we also determined the CDC is not a lawmaking entity. It's an agency. And
I'd
it's
like
funded.
the point that you're missing, I think you missed it, was that we have lawyers that work for Deer Valley, and we consult them. So Denise Britt is our lawyer.
I
and she-
appreciate your concern for
I know
lawyers.
you-
My concern is for children.
Yeah, but
The
when my
next
lawyer,
question.
when you become a lawyer, you
Circling
can
back
give
to
me advice.
quarantining, when we start talking about the quarantining, because the biggest thing I have from parents and the biggest concern they have, I did ask that they send me their concerns, because the quarantining is what sent our entire district into a panic. And that's what did. And my question has been from the beginning, is it coming from us to the CDC or to the Department of Health and then back to us? Or is it coming from the Department of Health? Has anyone ever actually been quarantined by the Department of Health?
Yes.
Yeah, I have as well. I had my daughter quarantined at a hospital. It's not the path that we're following. So the question that, when I take what the parents sent in, and I did say I would not reveal their names, but what was overwhelming is the contact tracing and whether or not it's being done appropriately, how it's being done. Are we using factual information? Because there are students who are quarantined and the date of supposed exposure, they were not in school. There are students who were quarantined and their best friend who sits right next to them all the time was not quarantined. So our parents want their kids safe, but they want to know that there's a consistency and a purpose and a reason in what's happening. So if I'm understanding what you've said as it went through all board members, is that we are identifying who to send, then we send it to the CDC, and then we quarantine. Is that correct?
President O'Brien and Ms. Fisher, no, that's not correct. We do not send the information to the CDC. We send the information to Maricopa County Department of Public Health. So our administrators and our nurses, they support with this as well. They check things like seating charts that are in their Google Drives, and there may be times, I'm aware, when someone has not been present when that occurs, and those parents can very easily check in back with the school, and they can let them know that if that occurs, my child was not there on that date, and then the school can help them with that. But when we do provide the close contacts to Maricopa County Department of Public Health, then we are instructed by them to deliver the mandated quarantine notice from them to the families.
The problem being is when the parents that have come forward, and I did send an email to all of you, they're basically told, keep your kid home, or we're going to call the police and we're going to call CPS on you. I don't know a parent who is going to want to talk to any district administrator who's threatening to call the police and CPS on them. And to coerce a parent in that fashion, to me, is just concerning. So,
But I think that's a very inappropriate characterization, Ms. Fisher, too, as far as when that occurs. What you're failing to include in that is that in those situations, parents have repeatedly told the administrator that they are not following the letter that they were instructed to do, that they don't care about that, and that they will be sending their child, no matter what, to the campus. And so there are times then when administration is forced to make sure the parent knows, if you indeed do that, here are the repercussions that could occur. And that's not just for a COVID thing. That could occur at any point when someone adamantly says, I'm going to break the requirements, the procedures, or the law for that.
it was the
So,
first,
so
it
you
was a
saying that the administrators are just
response.
coming out and telling them that, that's a very inappropriate characterization of our Deer Valley leaders.
It was a first-time response, and it
No,
was
that's
similar
a
to the
very
response I
inappropriate
received.
characterization. Very inappropriate.
The response I received was they should follow the rules. So I think we need to have a clear line for our families. We need to have a level of respect for our families.
And I
but we
believe our
need to
leaders
know
do.
how this
I
is
believe
going.
our leaders do. They do not wake up in the morning wanting to send kids home.
Of course they don't. They're following a confused process. What I'm asking is
No,
that we
that's
have
what
an
you're
appropriate-
implying.
That's not what I'm implying. I'm stating what I have seen and asking that we correct these issues. Because we will never unite our parents so long as we are beating them up.
So I think Mrs. Fisher, in order to handle specific cases, district administration is going to have to know if there is a student who is absent on a day of an exposure potentially, and there was a mistake made, the only way that that can be corrected is if a student name is given. So I don't know how else you said you don't want to give names or share names.
I
so-
can't give names. That doesn't mean that the parents, in what they showed me, their correspondence, it doesn't mean they didn't give names. I can't give their names, but the parents communicated with the
So you're
district.
saying that parents provided names to their administrators, and the administrators said you were here when the kid was there when they weren't there? That there was an
Well,
argument about that?
Didn't
Or
even get to that point. It literally was, they're quarantined, you must comply. If you don't, we will call the police and CPS.
okay, so
So I'm just saying
Those are
that was,
there are very different situations than what you originally asked about if there were an
So-
error in contact tracing. And I think that all parents should feel comfortable in contacting their administrator
Absolutely.
if there is an error in the contact tracing, i.e. your child was absent on the day that the student who had COVID was sitting in the chair that they would have been in had they been there. That is a completely different situation than you get a notice.
so what I'm asking for is that we are provided with a clear guideline of what is happening. A step-by-step, this is, and I know sometimes there will be one-off situations, but our parents should have a basic idea of this is what occurs, this is how a quarantine occurs. Because they're getting notification not 24 hours later, 10 days later, 9 days later. You got to quarantine 2 days because 8 have passed. Things of that nature. All I'm asking for, and I'm not trying to beat up on anyone, I'm simply asking to have a clear, official line put out for our parents. It's also beneficial for our campus administrators.
So when you say a clear official line,
Right.
the
We get
process is,
notification.
is
We
that-
do this.
okay. So the process, as I understand it, and Dr. Zurbach, please stop me if I get it wrong at any point. Please interrupt. You're contacted by a parent, sorry, not you, a principal.
It could be me.
Could
It's
be
a
you,
district or
okay.
a school directly. Yeah.
So we'll go with you because you're here. You're contacted that a student at Stetson Hills, I'm going to pick on them because they're in my backyard, has
My backyard too. Yeah, yeah.
has COVID, is COVID positive. Dr. Zurbach, I'm just going to let you lay it out rather than see if I understand it. What do you do once you receive that phone call from the parent or an email saying, my child was COVID positive on August 20th?
Sure. So again, in that situation, the parent normally uses our reporting tool that we have. That reporting tool asks for a series of informational points that the parent would enter in, such as when was the last date that the student was on campus, when did the student become symptomatic. The reporting tool also needs to have the proof of positive test included with it. So that information comes to us through our reporting form, and then we communicate out through our own internal communication system that we have to the school. The school, it's a channel that we call it, and on that channel would be any number of administrators, depending on schools. Obviously, they have more than our elementaries, and some of the schools have their nurses attached to it as well. The schools get that information, and then from there, they would start the contact tracing process, and the nurse also follows up with information that may be needed for the county reporting system. And when they need that additional information, then they need to follow up with the parent, okay, for that. And this is all happening on that day, okay, as far as the timeline. The administrators would then proceed with their contact tracing procedures for that. Again, many of them use seating charts that are uploaded by the teachers for that, and they may use additional measures as well, but at a minimum, and that's in our safety plan, we do rely on our seating charts for that due to the 6 feet and 15-minute close contact rule. Those names are then uploaded, again, through the county's recording tool. The nurse, for the most part, does that for us because they are communicating the COVID positive information as well. All that is sent up into an upload, and then county then responds back and says, these students need to be quarantined, and they provide that letter to us.
So when the administrator or nurse looks at those seating charts, and we have a seating chart on file for every classroom in the district, I presume?
I couldn't say if every classroom has that, but most of our classrooms, most of our administrators use that as their first tool, one, because of just the time that's needed to do
Right.
it. And so because when that doesn't happen, then you need to follow up with the teacher as far as saying, okay, let's check this student, who is sitting around there. And again, due to the time delays, that's why those seating charts, I should say due to the potential, right, for the time delay, is why those seating charts are so important. Now, some of our administrators may talk with their teachers regardless of the seating charts. But as we have communicated our expectations to the administrators that at a minimum, they would check those seating charts to check for the 6 feet.
And when they do that, do they additionally, as in this particular example Mrs. Fisher has provided us, would we check attendance of those students? If I find that there are 10 students, if I'm the nurse or the principal and I'm doing this check, and I have 10 students who were exposed, potentially exposed to that COVID positive student, would I then go check attendance for that day?
President O'Brien, I think some do. I don't know if all do. That is, I would need to ask our administrators as far as how they do that. I do know that regardless, though, we know that sometimes their attendance has to be cleaned throughout the day. So depending on when they might load that letter, there could be data that has not yet been cleaned by the attendance clerk for that. And so again, I would say when that happens, that the parent would just contact the school, or they could contact that Remain in School account that we've put out in our parent communications, because my team and I, we monitor that account, and we have seen several of those. We've seen probably 10 or less that have come in saying, my child was there or was not there on that day, and so then we pass that on to the administrator and ask them to follow up with.
Okay, so I would ask that you follow up with our administrators and health staff to see if to talk about checking for absences, and then
I can certainly do that. We have a level meeting this week.
appreciate that very much. I know we are all doing a lot more than we normally do. Our principals, administrators, and staff are doing a lot of extra. So, however, it is important that we keep as many students in class as we possibly can. And if a parent has an error, then they can either report it directly to you, Remain in School, through the remaininschool@dvusd.org email,
Correct.
or they could send an email to their principal.
Sure, it would be most direct to send it directly to the school, right, for that. And so, but we certainly try to help on the back end when we can through that email account.
I would agree that it would be most effective to go directly to the administrator at this school, because they would have immediate access to the information. Is that helpful, Mrs. Fisher?
The question isn't whether it's helpful to me, it's whether it's helpful to our parents, and I'll have to find out from them, because my concern would be is similar to what theirs has been. You're going to contact Trace on, say, first period class, when the infected student also went to lunch, and they went to second period, third period, fourth period, fifth period, however many. The biggest concern our parents are feeling is that whether or not their student is being quarantined is arbitrary. Whether it is or not, they feel that way. They also feel that the way it's being handled is a coercion to force them to either mask or vax their children. And that, we should never coerce that type of thing. And so that's what I'm hearing. I can only tell you what I hear. I can only tell you what the parents come to me, because it's them that I represent. And so these are the issues that are concerning to them, that they are arbitrary, and it's concerning to them that what is going to be the educational outcome for their child. And when it's my turn next, we'll hit that one.
So I would say that the decisions that are being made, I do not believe are arbitrary in any way, shape, or fashion. I would also, Dr. Zurbach, if you could explain why our administrators and health officials are having to do the contact tracing instead of the county.
In terms of the actual, the work of doing the contact tracing, so in terms of the actual work, that is really twofold. The first is just a capacity piece, as far as the county has relied on the schools for decades in terms of helping out when there is a contagious disease that is present. Now, that said, COVID-19 is quite different in terms of the magnitude of that. But when we have had previous cases of other contagious diseases, schools have entities that have supported public health and have provided names in order to contain whatever disease that might have been. So that's the first piece. The second piece then does go back to that capacity element, that there are simply not enough contact tracers that the county has for the level of COVID that is in our community. And so with that, county has told us that they need our support in order to do that. And so with the measures that they have provided to us and with the administrative code, that we need to support them with that as required by county health.
Thank you, Dr. Zurbach. Mrs. Reed?
So just to follow up on that, Dr. Zurbach and Dr. Finch, you can answer it too. Is the district picking and choosing with the kids that we quarantine to arbitrarily make them wear masks or vaccinate them?
President O'Brien, Ms. Reed, no, the administrators are not doing it arbitrarily.
Thank you.
Mrs. Ordway?
I could also add, President O'Brien, if I may, that county health is trying to step up support with the contact tracing. They have informed all of the superintendents in Maricopa County that they intend to deploy contact tracers to the schools to help. There is no exact date that has been put on that, but they are looking to do that.
Thank you, Dr. Zurbach. Mrs. Ordway?
Thank you. Dr. Zurbach, let's talk about that. So I had hoped that either Kip Schlom or Dr. Sonnenschein could have been here tonight to explain some of the things that you are having to explain. It's always much more helpful. So last year, we did not have to wait for the county health department to send letters because we were doing the contact tracing.
That is correct.
Okay, so this year we're not. Is there a way that the district leaderships of the districts, many of them, can talk to county health? Because I believe that training takes a while to get those contact tracers on board, and it only causes lapses in time, which means that there can be longer and more cases that happen. Because if we're waiting for the county health department's lapse in time, then Mr. or Ms. Positive, whether it be staff or students, if they choose to reenter a campus or a facility, and we don't have the information from the county health department yet, it just is this never-ending story of I'm sick, I'm quarantined, I'm not. And we have a simple guidance that you even put that says, you know, we should have mandatory indoor masks. And that would cut down on the quarantining. It might even, goodness knows, cut down on people getting sick, whether it be COVID or flu or strep throat. We do know that last year, our cases were lower than they were this year, and we used masks last year. We also, well, so anyway, so I'm just gonna leave that part there. So with the guardians and the parents that have, or employees, for those that have sent knowingly their students or themselves to our campuses and or facilities knowing that they have COVID, can you tell me what the number of people it had affected?
I'm sorry, Ms. Holder, could you repeat that one more time for me? I couldn't hear that.
We've had campuses where students were sent, where their parents or guardians knew that they knowingly had COVID. We've had employees that have known that they have COVID, and they have gone to our facilities.
That is
just
correct.
wondering-
That has happened.
Yes, I'm just wondering if we have any idea of how many people that might have affected, children and staff.
As far as the number of students that we are aware of that knowingly came, that is not a high number, Ms. Ordway. What is a high number is the number of students that come to school sick when it's obvious that the students are symptomatic. And then sometimes, not all the times, but sometimes those students do end up testing positive, which would place them at school during the infectious period.
My question more was, how many people were affected by those that had COVID?
When that
What did
occurs,
we affect?
it does have a negative impact when that occurs, because usually there is a cluster outbreak, if you will, as far as when that happens. And so it can result in many, many students that need to go home for quarantine. And it also can impact staffing as well. It is likely that a staff member may have been in close contact when something like that happens, because sometimes those students are on campus for more than just one day that are there. And Jenna could talk about that too, but it does have an adverse impact on operations.
And it already has, correct?
I would describe, if you're asking, has it created challenges for us? The answer is yes, for sure.
Are we going to have another round? Okay.
Okay. I have a question for Dr. Galligan. When students are either at home with COVID or on a quarantine, can you tell me, do we have, when we have materials available on Canvas, is there actual instructional videos so that a student who misses, 7th grade math, they can see a teacher giving an instruction?
President O'Brien, each of our teachers has the opportunity to download the courses that have been built. And those courses that have been built have complete lessons, including videos. All teachers need to do for those courses is personalize them with their own information, dates, and headings. Some of our teachers, however, have created their own Canvas courses. We do have a specific list of expectations for a Canvas course. So I would say that the majority of our teachers who downloaded our Canvas courses, either at K-8 or even into high school, those courses are set for children with everything they might need. Our teachers that have created their own courses, our goal is to ensure that they are providing the same level of instruction and support for kids at home.
And so is that a tight expectation that those instructional videos are available for every teacher?
For the downloaded courses, absolutely, because they're already built in. For the courses for teachers who chose to create their own courses, the expectation listed in those required expectations does have videos for students who are absent. And not only students who are absent, but as I've mentioned, students who just need another dose of that instruction from the teacher, whether it's the teacher's video or the video that has been pre-created, that is an expectation.
Okay, so I would just request that we discuss that with administrators. I think that we still have some teachers who might be missing that, and I understand that, we're not perfect, but we do need to get that. We have some kiddos who do want to stay up and who, I was contacted by a parent whose student has had 2 quarantines already, and she's trying to maintain an honors level load her junior year. So if we could ensure that our teachers are getting that Canvas instructional videos, either the ones available from district or if they're doing their own and they meet the qualifications, to please have those available to their students. This is certainly, I think, once again, turning out to not quite be the year we'd all expected it to. And I know we're asking above and beyond once again, but I also know our teachers want to provide the best learning opportunities for our students in what is another incredibly challenging year. Mrs. Fisher, I think we're going to make this our last round, and any additional questions will need to be emailed to Dr. Finch so that he can distribute.
I don't have that option, but I'll merge my questions together. And I don't care who answers. It could be Dr. Galligan or whomever. One of the biggest concerns that parents have shared is when they're students are seniors and are being repeatedly quarantined, and they're also either athletes or in band, or, they're trying to ensure that they can have their scholarships. They're trying to get into a university. So what is being done to support those students as well? And then the other one was just is there a way to notify our parents better when there is a sudden closure of an entire class? Apparently, there was a group of parents that were hit off guard by that. And then my final comment on this is I do find it concerning that we are making an assumption that parents wake up at the beginning of the day with the intent of doing bad and sending their kids to school. A parent may send their kids, my son has allergies. He has for the last 20 years. His nose sniffles. It doesn't mean he has COVID. And I don't think our parents set out to intentionally harm the district or other students. But those are my final two questions.
President O'Brien, Ms. Fisher, with respect to the times that we have converted or transitioned our classrooms to virtual, those certainly are unfortunate situations because those, again, typically are due to case cluster monitoring. They are sometimes also due to when there's staffing scenario that we just can't fulfill. And so after Mrs. Moffett works with Dr. Galligan and Dr. Chunis, as well as the Canvas administrator working all angles to fill that classroom as well, because we absolutely want the continuity of the in-person school. But in those unfortunate situations when we may see 5, 6, 7, 8 COVID cases that spring up in a 24 to 48 hour period, then that's a situation when Maricopa County looks at it with us with the case cluster and says the most appropriate thing to do is to transition that room to virtual. And sometimes that is without a lot of notice. And I concede that when that happens in terms of I wish there was a better solution, and I recognize that that can be very difficult on the families. When we do that, we have a parent communication that we send to the families, which has information about, first of all, food insecurity. So if a family is experiencing food insecurity, it has the contact information for the cafeteria manager so that they can arrange a date and a time where they can get food from the school due to our free breakfast and lunch. And then we also provide information about what the parents should and the children should expect as far as expectations from the instructor in terms of when they should log on to Canvas and any other pertinent information.
Do we have a safe learning environment option anywhere? Just curious.
But President O'Brien, Ms. Fisher, could you tell me more? What do you mean, do we have a safe learning environment?
Well, last year when we had kids who needed to come into a safe learning environment, do we have any rooms in any building within the district for, say, a parent who gets this notice on, I don't know, Monday morning or Monday afternoon and Tuesday, they have to have someplace to put the child? Do we have a place, just a room somewhere?
Gotcha, President O'Brien, Ms. Fisher. So you're referring to the on-site support from the state. And so that was a piece that we had in place this year. Actually, Dr. Finch and I have talked about that. Our most pressing challenge right now with that, Ms. Fisher, is staffing. And so is that we are first looking to staff our regular classrooms, and we are struggling somewhat with that. And so if we can find ourselves in a spot where perhaps there's additional staffing to do that, that is something that we could perhaps look at with a consult with Maricopa County in terms of some type of on-site support for that. But right now, our staffing does not permit us to entertain that. But again, if that would change in terms of our status, I can bring more information back to the board about that.
Mrs. Reed?
Um, circling back to COVID testing and
Sure.
talking about, additional opportunities and support that might be available. I know Paradise Valley has made their school nurses authorized testers, and school nurses can test. I think with a different company that they use. Is that something that the district is entertaining, that we could host our own at our schools, or is that something that is just not on the table at the moment?
Sure, President O'Brien, Ms. Reed. So what you're referring to Paradise Valley is they have the CLIA waiver so that their nurses can do that. That actually was something that was required last year, but that is not a requirement anymore to have for the home Binex Now test. So our schools can provide that without having that particular waiver. So yes, we could do that, and we hope to have the capacity soon to do that. That is related to right now just our testing capacity in terms of having enough of those. And so again, Ms. Mock and I are working on that, but I anticipate us being able to help support with testing opportunities through the schools very soon.
And just to clarify, the schools wouldn't be able to test a child for COVID if they suspected the child had COVID without their parents' permission, correct?
Correct.
Thank you.
Mrs. Ordway?
Yes. All right, let's move on to the fatigue and mental health of our employees, mainly all the staff. So, I know that we can't hire new people, but I'm hoping that we come to some kind of a thought process, or maybe a better plan that will, or different, or not better, that this is not good, but maybe an increased layer for our employees to be protected. So the fatigue of doing the tracing and the teaching and having you go and serve lunch because we have schools that don't have cafeteria workers. I mean, everyone's doing 3 to 5 times the amount of work, and I don't know how often the principals or the assistant principals are having to spend with their students engaged in academics. So just want you to know that all of you that are sitting out there and that are watching, that we do appreciate all that you have done and all the extra work that you have. The teachers that are sitting here in the audience appreciate you more than you know. And to clarify, Mrs. Fisher, I did not say that parents in general get up and want to infect other students or whatever it was that you said in that vein of thought. I said that we have had parents, guardians, and staff members that have purposely come to school knowing that they've had COVID and/or knowing that they're supposed to be quarantined according to county health. So that's your clarification there. I believe that most parents, no matter whether you want to wear a mask or not, or you think they're important or you don't, what you want is your kid in school, in a classroom, with teachers that aren't sick, that can teach, and bus drivers that can drive buses, and so on and so forth. So I'm just saying, that is what I was referring to.
Dr. Zerbach, just for a final
Yes, ma'am.
clarification, the quarantine requirements that were issued on August 15th, who developed those?
The President O'Brien, the quarantine requirements, just to make sure we're 100% clear on dates, it was August 12th when the provisions went up and posted on the Maricopa County site. We notified parents on August 15th after the Friday webinar from county. And county, along with the county attorney, along with ADHS, have created the guidelines and the requirements for quarantine.
Okay, so just wanted to clarify that those requirements were provided by, as you said, the county and the Arizona Department of Health Services. They were not,
And the county attorney.
and the county attorney. They were not developed by Deer Valley Unified School District. We are required under law to send out those notices. Otherwise, we could face legal consequences from the county.
That is correct.
Thank you, Dr. Zerbeck. I do want to thank you all for this very comprehensive report, and I think that having this on this report on every meeting that we have, I was going to say weekly, but I don't think we all want to be here. I know we like each other, but that's an awful lot. Will help to, as last year's report did, to clarify concerns, clear up misinformation. And so thank you. I know it's a lot of work to put all of that in there, but I do think it will be very helpful. I would like to move to put up public comments at this time and do DVUSD grading practices update after the public comments. Is there a motion to do that? Oh, I move to do it. Is there a second?
I second.
All in favor, please say aye.
Aye.
Aye. We will begin public comments because we had, I believe it's 23 requests for public comments. You will be allotted 1 minute and 30 seconds for each public comment. We have a total of 30 minutes for public comment. So due to the popular demand of being able to share your thoughts with us, which we are eager to hear, it will be 1 minute and 30 seconds, as you can see on the timer. Mrs. Ordway is going to our paragraph about speaking.
The board invites public comment on the district's business and in general, and on any agenda item in specific. All speakers must observe the rules of decorum. Speakers must fill out a card listing name, address, and topic, and hand it to the board secretary prior to the president calling the meeting to order. Speakers must make their comments in no more than this evening is 1 minute and 30 seconds. If necessary to accommodate, which we have, the 30-minute, the board president will shorten the speaker's time. Constructive criticism is in order. Rudeness, vulgarity, disruptive conduct, or remarks disrespecting personal dignity are not in order and will not be allowed. Under the Arizona Open Meeting Law, the governing board cannot discuss or act on any item not listed on the agenda. Board members may respond to criticism made by a speaker, ask staff to review a matter, or ask that a matter be put on a future agenda. I'm going to call 4 names at a time. If you would line up, and the microphone is right there. So I have Delphina Irani. Then I have Rajbi Gulak, Virgil Solomon, and Brian Wozniak.
So if you will step up to the microphone, state your name for the record, and then your time will begin.
It's on. My name is Delphina Irani.
Speak louder.
Could you step closer or speak louder so that we can ensure we can hear you and that our those who are watching us virtually can hear you as well?
Okay. My name is Delphina Irani. I am a mother of a 7-year-old, an educator, and a member of the DVUSD family, just like all of you. We want the same thing, to keep schools safe, our children safe, and to keep our schools open and running. The adults I see have a choice to protect themselves with a vaccination, but some of our children do not have that choice yet. Last school year, our kids were required to wear masks. So what has changed since then? Less community spread? Not really. I tell my daughter, we wear a mask to protect others from us. Masking up keeps the DVUSD family safe. DVUSD recently introduced quarantine measures. Thank you for that plan in place. Let me tell you how that will impact my family. My 2nd grader will be asked to quarantine if she is in contact with a peer who tested positive and is unmasked. It does not matter if she is wearing a mask and did her best to keep it on all day. She will need to quarantine. Are we to tell our children that rights trump responsibilities? I accept the quarantine measures as a cost to keep the schools open for everyone. I see the mask mandate as the same.
Thank you for your comments. So if our next speaker, please state your name and your time will begin.
My name is Rajbir Gulati. I'm a mom and a physician. Why mandate masks? Because prevention is better than cure. Because this matter is medical. It's not political. Because there are far more uncomfortable things than wearing a mask, like gasping for air, coughing up blood, being on a ventilator, or worse even, having your little ones be on a ventilator. In an ICU, having 20 patients who are geriatric patients in the ICU during flu season, that's acceptable. But having 20 kids in the ventilator is highly unusual and gravely worrisome. These patients are not going to die from COVID or the virus. They are going to die because the immune system is so weakened by the virus that bacteria and fungus will take over, causing pneumonia, sepsis, and death. Many would argue, well, kids don't get as sick as adults from COVID. Well, then let's look at this study recently published in Lancet. Greater than 80,000 COVID recovered individuals, age group kids, and adults were studied, noted to exhibit significant cognitive deficits months after the infection. Do we really want this for our kids? They have their whole life ahead of them to learn and grow. By not masking our kids in schools, we are placing them in the middle of dangerous medical experiment. One of my dear friends is an ICU doctor. She told me such a sad story. 15-year-old boy gasping for air tells her, I wish I had worn a mask. I wish my mom would have gotten the vaccine. Little did this boy know that his mom was struggling for her life in the adult ICU. Let's mask up. We can prevent this. Thank you.
Thank you for your comments. Please state your name for the record and your time will begin.
Thank you. My name is Virgil Solomon, and I'm with Concentric. Concentric is the sole source primary provider for COVID testing for the state of Arizona. There's $250 million that came to Arizona out of the CARES Act to pay for COVID testing. So whatever deal you have on COVID testing right now, you're paying too much. So the way the test is going to work simply is going to be that you can contact your students, you can test them weekly, you can test them monthly, you can test them whatever frequency you like. If you want to try it out in the 4th grade, you can do that. The kid's going to come up in the 4th grade class, let us suppose, they're going to swab their nose, they're going to put it in, all 25 kids are going to come up. That's going to be your pool test. Sonora Quest is our provider. Sonora Quest at midnight will give you results saying that somebody in the 4th grade classroom A is positive for COVID. Then you'll go back and then each of those 30 students will then take a test. And then they will find out what that individual is. They're going to say, little Johnny in the 4th grade class. We will send out a nurse. Sonora Quest will send out a nurse. There is unlimited amount of Binax Now tests that are available to us. They'll find specifically what that patient, what that kid's results would be, and then you can quarantine the kid or whatever your mitigation strategy is at that point in time. We're happy to meet with you tomorrow. We can get you started the day after that. You can test your kids Monday, Wednesday. You have no issue with the weekend. Thanks a lot for your time.
Thank you for your comments. Before you begin, Mrs. Orway is going to read 3 more names.
Yes. Rose Spalding, Chris Fitz, Chris DeRoche, and
That's good.
Rachel Waits.
Okay, thank you. Please state your name and your time will begin.
Dr. Brian Wellenseek.
Oh.
I'm here
Oh.
as a concerned
All right,
parent
that's
in the
okay.
district. And as
Step closer and speak up, please.
sorry about that. So I'm Dr. Brian Wellenseek. I'm here as a concerned community member and as a concerned parent and an immunologist and a virologist. And as such, I am extremely concerned about the lack of effective mitigation strategies in place in our campuses, especially in the wake of a much more transmissible virus variant. I was going to put together a little biology and virology lesson for you all, but as we're short on time, I'll just get to it. There is no credible scientific reason based in immunology or microbiology for the lack of required masking in schools. Simply put, the masking is the most effective mitigation measure in preventing the spread of COVID-19, which is a highly transmissible airborne virus on our campuses. But this isn't just my professional opinion. Nearly every professional scientific entity is calling for universal masking on our campuses. There's ample community support for that, as is evidenced by the letter of concern that was provided to you earlier with several hundred signatures on it. Please initiate required masking in our schools. It's the most effective way to protect our children against this airborne virus. Thank you.
Thank you for your comments. Please state your name for the record, and then your time will begin.
Chris Fitzwater. We went from 2 weeks to slow the spread to show me your papers real quick, didn't we? It's amazing. One little sickness comes around this country and everyone's willing to give up their rights and just bend over and take it from the experts. Ms. Fisher, thank you for your hard questions tonight. Sarah in the white, you were very disrespectful to Ms. Fisher. I listen to these board members say we have to be respectful. I think you need to as well, and answer her question when she asks a good one, and not scoff at her about masks are optional. The vaccine is optional too, right? Yeah. Have you heard of Nuremberg Code? Or coercion can't be part of the stipulation to get the vaccine? Yeah, you're in violation of that too. So back to my actual speech here. So each side has their sources, and nothing I'm going to say is obviously going to change anybody's mind here. But this debate boils down to two types of people: those who want to force others to do things against their will, and those who want to be left the hell alone. Only the latter can call themselves Americans. I know you mean well, but the road to hell is paved with good intentions. So please stop and rescind this BS quarantine, mask, segregation policy and get back to educating the children. 3 more fun-filled facts, and I'll leave you. Trump won. Biden's a child-sniffing pedophile. Epstein didn't kill himself. Live free or die, patriots. Good day.
All right, thank you for your comments. Please state your name for the record, and your time will begin.
My name's Chris Day. I'm a mother of 4, a 2020 graduate of Boulder Creek, 2 current high school students in Boulder Creek, 1 currently on quarantine. My youngest, who I pulled from the district in July of last year so he could actually start in person in August, like Ducey said we could. So I had to put him in a charter school so he could actually attend school. Every time I watch and come to these meetings, I hear all the data about cases. How many cases are in Deer Valley? Never once have you guys told us how many deaths have happened. So I'm curious, how many teachers have died? How many students have died in the last 18 months? 2. Nobody's mentioned that in all these meetings, so that's interesting to know. Students or teachers? Probably teachers.
One of each.
So in all of Arizona, since they started keeping track of COVID, only 35 kids under the age of 20 have died since the beginning. How many have died in car accidents, suicides, cancer? Okay. So I would love to, sorry, I have too much. So anyway, basically my son's under contact trace quarantining. He is not getting equal access to education. There's no live Zooms like there was last year. With technology, why can't we have live Zooms for these kids that are being quarantined unfairly? And it's not equal education. So do better, Deer Valley.
Thank you for your comments. Before you begin, ma'am, she's going to read a few more names. Thank you.
Amanda Lugo, Brooke Miller, Brent Rosenbaum, and Michael Hink.
Please state your name for the record, and your time will begin.
My name is Rose Spalding, and I have in my hand the oath that you all took, saying that you would abide to the Constitution of the United States, as well as the Constitution of Arizona. And I believe that every single one of you have failed in that.
because I've sat here today and you didn't even bother to talk about the RSV virus, flus, or anything else that our kids all grew up on, that we never had to quarantine them for. But yet now you feel that it's so important to take away the rights of our kids to breathe air and to go to school for something that they can't even prove. They've done no testing to find out or classify COVID. And you have this Delta variant that they don't even have tested for either. And yet you still constantly think that it's totally okay to run over the parents and not give them what the parents want. So as far as I'm concerned, you're fired. We don't want you anymore on our board. We don't want you to tell us what to do with our kids. So you're fired.
Thank you for your comments. Please step to the mic. State your name for the record, and then your time will begin.
My name is Amanda Lugo. My name is Amanda, and my oldest son is a freshman at Sandra Day O'Connor High School. Sorry. He is immunocompromised and medically fragile, but he is so much more than that. He is funny, he is sweet, he is kind. My husband and I lovingly refer to him as everybody's hype man, because he will always be there cheering on every single one of his classmates. We spent over 16 months in a bubble, cautious about even taking him to the hospital during his worst illnesses and seizures. Being out of school was detrimental to his physical and mental health, which I'm sure all of us can agree on. But COVID would be a death sentence for my son. Unfortunately, during this pandemic, he was also given a diagnosis that will eventually end his life. He deserves to have what is left of his life filled with friends, school, and more life, not locked away from a pandemic. Yes, I am afraid. We're afraid of being robbed of what little time was left of my son's life. And I pray that those of you wanting to go unmasked never have to live through this hell, knowing that his years are already numbered, but being unable to make the best of this time because the parents of the students who sit next to him in class don't care whether he's there sitting next to him or they're attending a vigil for his death. My son is not a statistic. He deserves more. Do better.
Thank you for your comments. Please state your name for the record, and then your time will begin.
My name is Brooke Miller. I'm speaking on behalf of my two nephews.
You step a little bit closer to the microphone. Thank you.
I'm speaking on behalf of my two nephews. I'm also a middle school teacher outside of the district. Firsthand, I have witnessed this week alone in my classroom the number of students that have had to be quarantined that are perfectly healthy. I had 8 eighth graders in my class today. And not only that, I had to be responsible to have work for every single one of those students. And my goal as a teacher and an educator was that they could have a good education. Do you think being quarantined, they're getting a good education? This comes from my sister-in-law. Both of her 2 boys have been quarantined in the last 2 weeks. It is evident from the letters that we have all received that the district's motives are clear. Your students must be injected with a vaccine or they will be subjected to immediate quarantine without notice if they come in close contact with someone who has tested positive for COVID. Your student will be sent home with no online learning options, and they will be punished for their family's decisions not to have them vaccinated. Not only is this approach devastating to the mental health and welfare of our students, it is not supported by science. According to the CDC, to date, over 55,000 children under the age of 18 had complications resulting from the COVID vaccine, while 430 children have died with COVID. I want to emphasize the words with.
Thank you so much for your comments. Please state your name for the record, and your time will begin.
My name is Brent Rosenbaum, and I'm a parent a former student in Deer Valley District, and I just want to say, first of all, thank you to all the leaders who have to put up with this garbage all the time, and for the administrators who have taken on extra work. Both my parents worked in education, and they really dedicated their lives to serving students just like you are, and I can't imagine having to deal with this. Ms. Fisher, you say you represent parents. My family and friends of mine have emailed you. You only give partial information when you're up there. You don't represent the parents who email you concerned about kids, concerned about their kids who shouldn't have to deal with quarantine and how masking can reduce that. You represent a segment of the population which only 27% of Americans oppose mask mandates in schools, while 62% of them support it because they want their kids in school and they understand the basics of airflow, that it actually slows down the air as it comes out and filters it. So obviously, if it's an airborne virus, it's going to spread less. This isn't hard. It's not really science. You don't need to be a virologist to understand. It just makes sense. We all do it all the time. So again, can't make it through without people just like last time. So enjoy.
Thank you for your comments.
Ms. O'Brien?
Before,
In general, we cannot respond to questions or concerns, but we can reply to criticism. I would like to share with you, sir, I absolutely represent you. I have read every single email that I received from the organized email that came to us. That is the reason I went into research mode. And I looked at the efficacy of masks. I looked at the increase in the pneumonia. I looked at the death rate of our students. So I did take your concerns very much into consideration. And that's true of any of the parents who sent those emails in from that group. I support any parent that wants to put a mask on their child, but I additionally support the parents who do not wish to do so because
Do you support drunk drivers?
because
sorry, sir, your time is
Nope.
up. She does get an
because there-
opportunity to
because
respond.
there is data that shows.
Sir,
Sir,
thank
I
you.
responded to your criticism. That's the fact.
Okay. Thank you, sir. Before you begin, we're going to call some more names.
Yes, we are. Alinda Lose, Sean Rohr, Chris Petrie, and Lindsay Ellis.
Okay, sir, if you'll step up to the microphone and state your name for the record, then your time will begin.
My name is Michael Hink, and I am a parent here in Deer Valley. I'm going to be brief because a lot of this has already been covered before. First of all, I wanted to thank you all for the effort that you have been putting forward this year and in previous years, or in the previous year as we go through all this. I will add that my child has worn a mask to school so far this year with no issues. She is exiting school-imposed quarantine today because of continuous close contact with a child who contracted COVID. My child never got sick and never tested positive, while other children at her table are now quarantined for longer because they were unmasked and are now positive. As of yesterday, half of the class is now home. I pray that they are safe and that those who are positive have mild symptoms and their parents don't have to experience the tragedies of others through this pandemic. We can help stop this. We can help our kids and keep our kids in school, and all it takes is a mask. Thank you.
Thank you, sir. Please state your name for the record, and then the time will begin.
Amanda Lose. This is my fourth year teacher. I'm a fourth year teacher for DVUSD. I'm also a student of DVUSD of 10. After graduating college, it was my goal to come back and teach within the district I learned at. With everything going on in the world and just within our community, I feel the best thing to do is to always stay informed with the facts. Someone very wise told me I should start by watching the board meetings. So I started watching every board meeting since COVID disrupted our lives, not only within education, but within each of our own personal lives. From watching the last couple of board meetings, it has been absolutely appalling and shocking the way some people are treating other human beings. So I thought it was needed to remind everyone here and who is watching that all I really need to know I learned in kindergarten by Robert F. Share everything, play fair, don't hit people, put things back where you found them, clean up your own mess, don't take things that aren't yours, say you're sorry when you hurt somebody, wash your hands before you eat, flush, warm cookies and cold milk are good for you. Everything you need to know is there somewhere. The golden rule and love and basic sanitation, ecology and politics and equality and sane living. Take any of those items and extrapolate that into sophisticated adult terms and apply it to your family life or your work or your government or your world, and it holds true, clear, and firm. To Dr. Finch, Miss Taylor, Dr. Zerbach, Dr. Galligan, Mr. Miglorino, Mrs. Moffat, and Miss Mock, thank you for everything you do. As a teacher, I try to hang on to the positives as long as possible. Many people say this is why you get paid the big bucks, but no one signed up to add COVID to your job description. So I appreciate everything you are doing.
Thank you for your comments. Please step up to the microphone and state your name for the record and your time.
I'm Sean Rohr. President O'Brien and board, I thank you for your service. I believe that a lot of times serving on the school board is challenging, and I know you're not being paid, but I also know it is a stepping stone to other political careers. I know some of you are pursuing future political careers and are already doing that and other things. I also know that all of you are, I believe, at one time were all registered Republicans. And I would suggest that you know that you are being watched. And some of you have attended LD meetings. I'm involved with LD 15 and LD 22. I would welcome any of you to come to a meeting and explain what's going on here. You would be allowed to speak, and I think it would be nice of you to do that. That's really all I want to say, is that you are being watched, and for your future political careers, whether you're here or somewhere else, that we are watching. Thank you.
Thank you for your comments. If you please step to the microphone and state your name for the record, then your time will begin.
Hi, I'm Lindsay Ellis. I'm a parent of a first grader in Legend Springs. I want to start by saying that I didn't come here today to talk about politics, even though I know many of us are on opposite sides of the COVID arguments. I'm here because I'm a parent who cares about my child, his teachers, friends, and your children. Protecting our children should not be something that we have to debate on. Children need to be in school. I'm not sure about all of you, but having a kindergartner home last year while trying to work and make sure he accomplished what he needed was near impossible. I know as much as it taxed the parents, it was also a huge challenge for all of the teachers and school administrators. However, it was necessary to try and mitigate the spread of COVID. When my child returned to in-person learning, he was a new kid who really thrived. So why am I here? I'm concerned, like lots of others are, and it feels like it's been kind of a mess since school started. So what's the answer? I'm not a medical professional, but I feel there are some things that can and have worked in the past. Although highly controversial, kids under 12 should be in masks. This is the guidelines from the CDC and the American Pediatric Association. We need to listen to the professionals. If we keep them optional, then our teachers should be preaching the importance of them and even wearing them to set an example so kids don't get ostracized that are wearing them. Reinstate the social distancing we had last year. And then with staggering drop-off and pickup times, I see at his school, kindergarten has their own time, and then 1st through 6th grade all walk out together in a big group with big groups of parents. Maybe we just make certain times, and that's the only time that each grade walks out. Limit the amount of kids on the playground, temperature screen, and zero tolerance for kids coming in sick. No assemblies or in-person meetings like curriculum nights. Thank you very much, and thank you for all that you do.
Thank you for your comments. Sir, before you begin, we're just going to call a couple more names, okay? Just hold on one second.
Katie Gano from Desert Sage, Michelle Archibald, Jim Cahill, and Adrienne Perry.
Okay, sir, please step up to the microphone, state your name, and then your time will begin.
Hi, my name is Chris Petrie, and I have 2 kids at Copper Creek Elementary School. I'm going to be on the opposite side of a lot of these parents here. I am anti-mask, and I believe that us parents, we love our kids more than anybody else. I love my kid more than anybody else is in this room, and therefore I want my kid to be safe. Putting a mask on my child is not what I believe is safe. And the reason why, as a Phoenix firefighter, for the last 18 months, I've been going on calls COVID-related. COVID is real. But I'm also seeing kids trying to commit suicide. We've had a kid put a shotgun in his mouth at our station, and he ended his life. He was in 8th grade. No one is talking about what's happening when we send kids home, when we put them in masks all the time. This stuff is real. And this is why I decided I need to come and I need to speak and tell people what's really going on. If you want to put your kid in a mask, absolutely, please do. You have that right as a parent. But for those of us that don't want to put our kids in masks, we don't want to send our kids home for 10 days. There's a reason why. We love our kids and we all should have the choice. We elected the board. I pounded signs for some of you people, for two people up there, and I was proud to do it. And what I'm asking for is, can you please represent all of us? Last week on Sunday, we got an email. We got an email saying that tomorrow there's going to be a new rule. And I asked somebody on the board, not Kim, it was somebody else on the board. I asked them, why did the board not vote on this? And they said it passed through, and Dr. Finch pushed it through without a board approval, and they didn't need it. My question is, why is that happening?
Thank you for your comments. We have your, please state your name for the record, and then your time will begin.
Hi, my name is Katie Gannell. I'm a parent of a first and third grader at Desert Sage. I'm here today as a concerned parent because I will be honest, I was really proud of our district last year. We kept my kids in school. When that time frame opened up and we were able to keep those kids in school, the numbers were low. They wore masks. They had some precautions. They had to stay away from each other. My son was a kindergartner last year. His first experience of school was wearing a mask. He didn't come home, he didn't complain. Sometimes we ask our kids to do things they do not like go to bed at 8 o'clock, eat vegetables, do some of those things that just aren't their favorite things to do. My daughter's third week of school, half of her entire class was out and her teacher was out in third grade. We're already experiencing this. She described to me her day last week. She said, "Mommy, today was crazy." I go, "What do you mean by crazy?" At 8 years old, that could be anything. She goes, "Well, we didn't have a teacher today. My principal was our teacher because my teacher's been out. I don't know why my teacher's been out. I, as a parent, have not received anything about why her teacher has been out." She said, "Because we didn't have a teacher, the principal walked us to lunch. A different teacher walked us to specials. A different teacher did this. Is this really the way we want our year to go for our elementary students?" I doubt it for all of the people here, and I feel like it's a small price to pay to put them in a piece of cloth.
Thank you for your comments. Please state your name for the record, and then your time will begin. Actually, can you step to the other microphone? I think that would be better.
Probably a little closer,
Hi, my name is Dr. Michelle Aristi-Sabel. I'm a local OBGYN in your district. I take care of many mothers of students in your district. And I'm here today to encourage you to do things to keep your children safe as well as make my job easier. I've heard a lot of people comment tonight that COVID really isn't making kids sick. It's not really dangerous to kids. But one different perspective that I bring is that a significant number of your students live with an immunocompromised person, and that is a pregnant mother. A pregnant woman is much more susceptible to contracting COVID. When they get COVID, they get sicker. They also are at significant risk of pregnancy complications and can even lose their pregnancies and their lives, which is happening across this country right now. We know that keeping kids from becoming infected is the key to keeping mothers from becoming infected. A lot of people say that masks should be up to the individual parent. However, what they don't realize is that the mask does not protect the child wearing it. It protects the child that they're sitting next to. If I put my child in a mask and they sit next to somebody with COVID, their chance of contracting COVID is 40%. If the child with COVID is wearing a mask, that risk goes down to less than 1%. A 40% risk of COVID with my child sitting next to a COVID infected child is not acceptable. Change your policy.
Thank you for your comments. Please state your name for the record, then your time will begin.
My name is Jim Cahill with 4 grandkids at Deer Valley. I just want to let you know that quarantining healthy children must stop, but it's also important for you board members to know there's a statewide effort underway that will protect our children. because under the law, there is per case state-funded representation to challenge any decision for healthy children to be quarantined from their school district under ARS 36789. Per that, you have got the court. The court shall appoint legal counsel at state expense for each and every person who is subject to quarantine under the directive. In short, the district is on notice. The volume of lawsuits are headed your way. Each child has a right to state-funded representation, and they may file a lawsuit against the district in violation of their rights. Representative lawsuits may include how children were selected for quarantine, violation of privacy laws, the entire practice of imposing COVID-related quarantines, length of quarantines, and most importantly, students not receiving adequate instruction while in quarantine, and a lot of undue burden on families. If you don't adhere to the law and change your approach, this is going to be a costly endeavor, putting undue pressure on taxpayer education. My plea to you, is this how you want to spend sparse education dollars? Stop this quarantining of healthy children and return to giving healthy children their right to an education. Thank you.
Thank you for your comments. Before you begin, ma'am, we're going to call our last few speakers up to get in line.
Looks like John Denton, Chris Thiel, and Kelly Irvin.
All right, if you'll step to the microphone, state your name for the record, and your time will.
That's on.
Adrian Perry. I'm a mother of a student at Sonoran Foothills, and my husband is also severely immunocompromised, needs a kidney transplant and on chemotherapy. However, unlike the other immunocompromised people, I disagree with what they're saying.
Will you step closer to the microphone? Thank you.
Okay, did you hear any of that? Okay, so hi, I'm Adrian Perry. Can my time start over then, please?
Keep going. We'll let it go.
Okay, so Adrian Perry, Sonoran Foothills. I'm a former teacher also, and my husband is severely immunocompromised. He needs a kidney transplant and on chemotherapy. But unlike the other people that have family members immunocompromised, I disagree with what they're saying, as do my husband's doctors at Mayo. Anyways, there's been a lot of great points. I appreciate Kim Fisher for bringing them up. Didn't really like the response and the scoffs from, oh, they're not mandated. Actually, your quarantine policy is indirectly mandating masks and vaccines. But I'll just leave it at this. My main point, my phone, is that if the federal government was really that concerned with COVID, then our borders would not be open. Our borders are wide open with hundreds of thousands, actually millions, over 1 million people have come through the border this past year. 212,000, over 212,000 just in July, a record-breaking number. Unvaxxed, unmasked, many COVID positive, and they're just being released into our population. If the federal government was really scared of COVID and what it's doing, our borders would be closed. So I'm sorry, I'm finding it hard to believe that they're really that concerned. Thank you.
Thank you for your comments. Please step up to the microphone, state your name for the record, and then your time will begin.
Can you hear me okay? Thank you. My name is John Denton. I'm a teacher of music and choir at Sunset Ridge School here in the district. I just wanted to take a moment and just realize some observations from inside the classrooms from a teacher's perspective. First and foremost, my students, both masked and unmasked, are wonderful and amazing people. My students are resilient and have no problem protecting themselves. Masks offer an easy solution, and during the entire year of wearing them during the 2020-21 school, I had 0 complaints from students in the classroom. I teach music and choir, where respiration is key. And last year, few students complained of use. The few who did were given breaks and respected in a safe area. This year, requiring masks could be the least we do as a district to ensure in-class learning continues. I came to this realization today after I taught 8 students of a 30-person class. The numbers of quarantine students are massive this year compared to the last, and I believe a lot of that has to do with our mitigation strategies with the masks. The least we can do is to simply ask all students and staff to wear a mask during inside instruction. I deeply appreciate the extension of mitigation strategies from the previous year, but we can and should do more. We are extraordinary, correct? If not, we are ignoring the very science and data we promote during instruction. Thank you.
Thank you for your comments. Please state your name for the record. Make sure you step close to the microphone, and then your time will begin.
Kelly Arvin, and I have to agree. What I saw tonight disgusted me, Dr. Finch. The way you treated Fisher
for the way she is representing us and asking questions that we have. How dare you act like that? The quarantine guidelines that this board has implemented are discriminating against students who have decided not to take the shot of COVID nor wear a face covering. This is a shameful display of using our children as political pawns. Over the course of COVID, if you take the deaths of people who died while they tested positive for COVID and you compare it to the attempts of suicide, the attempts of suicide is 4 times that of COVID. So that's the issue, and others like heart disease, which is 2 times. Why are we not addressing those issues? And I think that is what Ms. Fisher was getting at. You're so focused on COVID, and you have a 30-minute PowerPoint for COVID guidelines, and you're not reaching into any of these other issues that's facing our children, that's facing your students. We all know it's humorous, really, to watch people come up here and use their masks and talk about how we need to use them while they touch them and move them and they fall down. So obviously,
Thank you for your comments.
I'm going to make one more call for Chris Steele. All right, well, there we go.
Okay. Thank you, everyone, for participating in our public comments this evening. So we will now move on to the DVUSD grading practices update. Dr. Galley, give us your presentation.
President Ordway, President O'Brien, Governing Board, and Dr. Finch. Our work toward grading and reporting revisions to improve grade accuracy and better align with our PLC and teacher collaboration and student learning practices in the district continues. Tonight, Kathy White and I will provide you with an update on where we are in the progress. The goal for this work are to ensure grades are based on student achievement, knowledge, and skill proficiency and are separate from behaviors. They promote consistency in grading across teams, departments, and schools, and provide parents and students with ongoing, credible, and useful feedback that conveys the expectations and achievement of identified standards of knowledge included in the curriculum and the Arizona State Standards. As teams have engaged in the work of revising our grading practices, they have leaned upon this guiding principle, which was developed by a large stakeholder team at the beginning of the process, and this has been over 3 years ago. Authentic grading accurately measures and reflects a student's performance based upon mastery of standards. Though through the work of the teams, 2 areas were identified as areas that needed revisions to improve grade accuracy, clarity, and consistency across our system. The first area was the removal of behavioral elements from academic grades. When grades include other elements such as attendance, tardies, bringing in supplies, misbehavior, dressing up for spirit days, donating supplies, and many other, the meaning of the grade is diminished. We begin to question if the student is proficient in the content or if the student's grade was enhanced by being congenial, bringing in extra Kleenex boxes for the classroom, or demonstrating other desired behaviors to bump their grade. Likewise, we might ponder if a student truly lacks ability in a content area or if the student's failing grade or low grade is the result of talking out of turn, being tardy in class, writing their name in the wrong place on the homework assignment, and other non-desired behaviors. By removing behavior penalties and credits from the academic grade, we can better ascertain a student's level of proficiency against the standard. The second area identified was the grade scale. With a 0 to 100 grade scale, there are 101 indicators, with 60 of the indicators representing a failing grade. Zeros on this type of scale are especially problematic since the recovery from a 0 is astronomical. The teams looked at many grade scales and determined that the 4 to 1 scale for grades K6 and the 4 to 0 scale for grades 7, 12, was the best fit for Deer Valley. With the 4-to-1 and the 4-to-0 scales, the levels are evenly dispersed, which help to remedy the calculation issues that occur with a 0 to 100 scale. Additionally, fewer indicators increase consistency among grades. For example, with the 0 to 100 scale, a student may earn a 75% with one teacher and an 82% with another teacher on an assignment. But with the 4-to-1 or the 4-to-0 scales, it is likely that both teachers would score the student with a 3 or proficient. It is important to note that a 0 and a 1 on the grade scales represent a failing grade. This means that if a student's grade averages to a 1.4, the grade will round to a 1, which is a failing grade. If a student's grade averages to a 1.5, the grade will round up to a 2, which is a passing grade. Determining what proficiency on a standard looks like is what PLC teams will work together on by examining the standard and the standard's learning progressions. The new grading practices are an excellent fit with our PLCs and teacher collaboration processes and strongly support the district's intervention processes with MTSS. For citizenship or conduct, we will remain with the ESNU scale for grades K-8. I'm going to turn it over now to Mrs. Kathy White.
So the work on the grading practice revisions has been a 4-year journey so far. 4+ years ago, a groundswell of interest from parents and teachers in grading practices, concern around the lack of consistency and concern over minimal established grading expectations began to grow. So to address these concerns, a large stakeholder group was formed to evaluate current practices and gather input on where revisions should be explored. The committee of around 100 people, which included teachers from every grade level and every department, K-12 administrators, support staff, parents, and district personnel, was formed. The team created a guiding principle for what grading in our district should represent and identified some areas to examine. The team was divided into 3 work groups: a K-6 grade band work team, a 7-12 grade band work team, and a steering committee. The grade band teams worked through grading practices and grade scales, while the steering committee addressed timelines, communication, technology aspects, and training components to support grade practice reform. In the 2019-2020 school year, a short 4-week pilot of the new grade scales was introduced for first grade. The pilot was concluded early because we discovered that percentages could not be turned off for a single grade level, only for a full school. And this made the parent view too confusing. However, we were able to glean some excellent information on the use of these grade scales, which helped the teams to develop refinements. During the 2020-2021 school year, the work toward implementation continued with revisions to the Promotion, Retention, Acceleration, and Grading Guide, also known as the PRAG, and the creation of a companion document for the high school level, which is called the Grading, Reporting, and Graduation Guide, or we like to call the GRAG. Additionally, during the 2020-2021 school year, an adjustment was made to the implementation timeline due to COVID, pushing back full implementation to the 2022-2023 school year. A phased-in process toward full implementation was developed, with 9 schools selected to deploy the new grade scales the year prior to full implementation. The school year concluded with a guest speaker event for administrators and teacher leaders to solidify their understanding of the grading practice revisions. This school year, all schools are implementing the removal of behavioral elements from academic grades. On a side note, removing grade penalties and benefits for behavior does not mean students are not held accountable for their behaviors. Instead, undesired behaviors are met with appropriate consequences. Things such as redirection, intervention, loss of privileges, and discipline. The 9 Phase 1 schools are also implementing the new 4-to-1 and 4-to-0 grade scales. In looking forward to next year, training of teachers and staff will continue, as well as communication with parents and revision to our guiding documents as needed. The work for this school year is heavily focused on supporting the 9 Phase 1 schools. Schools applied to be part of the first phase of the grade scale implementation. Schools were selected based upon 3 factors. They had experienced principals and administrative teams, had highly effective PLC practices in place, and had strong community support. The Phase 1 schools are Anthem, Barry Goldwater High School, Deer Valley Middle School, Norterra Canyon, New River, Sandra Day O'Connor High School, Sunset Ridge, Union Park, and Terra Mar Academy of the Arts. These schools represent a variety of configurations, student body size, age, regions, and socioeconomic status. As mentioned before, the PRAG documents were updated to reflect the revised grading procedures, and a new document for high school education was created called the GRAG. These documents are created for faculty and staff, but parents and community members are more than welcome to read the documents as well. These guides can be found on the district website. It's on the Parent and Students tab, and then click Handbooks and Forms link. Training and support for DVUSD educators continues this year. A Canvas course is available to all staff with modules to help them with understanding the shifts in grading and how to manage their grade book. Site administrators are also delivering professional development to their staff during professional development days, staff meetings, prep talks, and department or level meetings. Gradebook support is available to Phase 1 teachers by the way of 2 district gradebook coaches. The gradebook coaches are teachers with considerable knowledge in grading practices, and they are very tech savvy with use of the electronic gradebook. Phase 1 administrators are participating in biweekly meetings to share ideas, advice, and knowledge to support the implementation of the grading revisions on their campuses. And all administrators are receiving training during their monthly administrative meetings, which they are then able to replicate with their own staffs. Parents of students in Phase 1 schools were invited to a webinar. The webinar featured Mr. Tom Schimmer from Solution Tree, who is an internationally recognized expert on grading practices. For any parents, staff, or community members unable to attend, please look for a follow-up video to be posted on the district website very soon, which will include information for some of the highly requested topics and responses to questions submitted before and during the webinar. Parent communication has ramped up since last spring. A space on the district website has been created to house information on district grading and reporting. A letter was sent to all parents last spring from the district, and then a follow-up letter from the principals of all Phase 1 schools was sent out last spring. This fall, parent communication has come from the classroom teachers in the form of their class syllabus, meet the teacher nights, curriculum nights, teacher web pages, and or teacher videos. And of course, a parent webinar was presented. Other behind the scenes work that has been transpiring includes the revamping of report cards to include the new grade scales and keys. High school transcripts have a new key with both the A through F and 4 to 0 scale with the GPA conversions for all grade indicators. Please note that the 4 to 0 grade scale does align with the 4.0 GPA scale and the 5.0 weighted GPA scale. We have met with representatives from Rio Salado who are in support of the new grade scale. They have advised that other grading practices will need to follow the college parameters for the dual enrollment classes. We also have reached out to some of our state university admission directors who have assured us that the 4 to 0 scale is not an issue since the scale converts to the normal GPA weighted and unweighted scales, which is what they rely upon. The kindergarten report card will look very similar to years past. Kindergarten has used the 4 to 1 grade scale for nearly a decade. Students will receive grades for essential standards in the core subject areas. The last page of the kindergarten report card will continue to have a place to note behavioral areas of concern. The special subject areas, so that is like art, music, PE, foreign language, technology, will have a dedicated area to report both achievement grades and as well as citizenship conduct grades with the ESNU scale. When students enter the primary grades, the report cards will show grades on the 4-to-1 scale for the essential standards in the core subject areas taught during the quarter. See the blue box in the call-out image. That's an example of the 4-to-1 scale for the essential standards. They will also receive an overall grade for the subject area, which in the case of schools that have transitioned to the new grade scale for the course grades, that will be on the 4-to-1 scale, as you can see in the example in the red box image. The second page of the primary report cards include a key. Students from schools that have not yet transitioned to the new grade scale will see the 4-to-1 grades for the essential standards and the ESNU grades for the overall course grades. Students from schools that have transitioned to the new grade scale will see the 4-to-1 grades for both the essential standards and the course grades. Similarly to the kindergarten report card, the last page of the primary report card has an area for the homeroom teacher to mark behavioral areas of concern for the quarter with an X, and special subject areas will show a grade for achievement and citizenship conduct. The third grade report card looks a bit different, with each course listed on the front page. In the column for each quarter, students will see an overall grade for the course, which will be on the A to F scale for schools that have not transitioned to the new grade scale yet, and, as in the example, on the 4-to-1 grade scale for schools that are on the new grade scale. See the green circle in that call-out image. Citizenship conduct grades will show for each course, of course, using the ESNU scale. You can see that in the orange circle. The key for all scales will be included on this page, as you can see more closely in the purple call-out image. Please note that the first, second, and third grade report cards include a notice regarding ARS 15-701, which is commonly known as the Move On When Reading Law, as you can see in that yellow box at the top of the slide. The second and third pages of the third grade report card include grids, where teachers will mark student proficiency on the essential standards for the core subject areas using the 4-to-1 scale. The report cards for grades 4, 5, and 6 look like the third grade report card, except that the box with the Move On When Reading statute notice is removed. The report cards for 7th and 8th grade contain an area to list course titles and instructor names, with columns to report the grades students earned for each quarter, as well as for the overall yearly grade. In that top call-out box, you can see that there's an example of grades reported for each course using the 4-to-0 grade scale. And you can see that in that green circle. Students at schools that have not yet transitioned to the new grade scale, they will see an A to F grade in that spot. As you can see in the orange circle, students will receive citizenship conduct grades using the ESNU scale. And then in that pink highlighted box, that is an image that gives you a closer look at the key for explaining the A through F and the 4-to-0 scales, as well as the ESNU scale. And then there's other symbols that are also reported too, such as the I, the N, the P, and the W. Parents of high school students can log into PowerSchools to see their child's grades or can request a printout of the report card from the school. High school student grades are officially reported on a high school transcript. Here is an example of a high school transcript. You can see that A to F grades earned in previous school years or at schools not yet using the new grade scale will remain as A to F grades as reported. So let's take a look at this transcript. In the blue box for Theater 1-2, this student earned a B for both semesters, each of which resulted in 0.5 credit for each semester and 3 GPA points for each semester to be averaged into their overall GPA. A GPA stands for grade point average. Two classes below that list, you'll see Geometry 1-2 Honors. And we can see that this student earned a B in the first semester, but because this is a weighted honors course, they earned 4 points towards their GPA. And then in the second semester, when they earned a C, they earned 3 GPA points. In that red box, you will see the new grading scale represented for the forensic science course. For the first semester, the student earned a 3 as a grade, resulting in 0.5 credit and 3 GPA points averaged into their overall GPA. For the second semester of this course, the student earned a 1 for the grade, and since you need at least a grade of 2 to pass the course, they did not earn any credit and will average a 0 into their overall GPA. In the green box, we can see that this student took AP United States History, and that course was using the new grading scale. Since AP courses are also weighted, you will see that this student earned a 4 as a grade for both semesters, for each semester, and then they earned half credit and 5 GPA points for each semester to be averaged into their overall GPA. This type of blended transcript is common when a school district makes a grading change, and so colleges and universities are used to interpreting the classes and grades. But as you will see, the standard 4-point GPA with honors weighting to 5.0 GPA process is still in place. At the bottom of the transcript will be a key to help explain the information. In talking with some of our state university admission directors, they confirmed that they receive transcripts from all over the country and all over the world and are quite used to evaluating transcripts using a wide variety of grading scales. Having a key with the grade point average or GPA conversion scale is what they rely upon to evaluate transcripts for admissions and scholarships. Likewise, DVUSD's class ranking utilizes weighted GPA averages as we have normally done.
After a parent letter was sent last spring that included a link to submit questions about grading changes, we received 91 parent questions. We want to thank all of the parents and community members who submitted questions, as these were extremely helpful in creating our frequently asked questions page on the district website. Parents are encouraged to visit the FAQ site by going to dvusd.org, clicking on Parents and Student tab, and then clicking on the Grading and Reporting link. From that page, you can select the FAQs from the menu on the left. The page will be continuously updated as additional questions are collected from our parents. Please let us know if there are any questions we can answer this evening or provide to you in a governing board update.
Thank you so much for your presentation, Dr. Galligan and Mrs. White. Do you have any questions, board members? Nope. Okay. If anybody has any questions, they will email them to you and we can have them answers provided in the update. Having said that, bear with me while I get back to our 5A. Oops. Could I have a motion to approve 5A?
I move that we approve item 5A, kindergarten. It's there. That the governing approve the administration's request for an adjustment to the gifted ELA adoption resources.
Second.
Okay, and this item is submitted as old business. Is there any updates that you'd like to provide, Dr. Galligan?
President O'Brien, nothing beyond what was shared in the board update. The main reason we are bringing this back is that some of the resources moved from Proofrock Press to a new vendor, and our purchasing department felt it would be wise for us to bring this to you. In addition, you will notice that the original adoption amount went down, and that is because some of the binding for the books, that price decreased as well. So we have actually decreased in the adoption request cost.
Well, that is always good news when we can save money. Are there any questions from board members? Okay, seeing none, all those in favor, please say aye.
Aye.
Aye. Hearing any nays, hearing none, motion passes unanimously. I voted. Okay. All right, and can I have a motion for consent agenda?
I move that the governing board accept the consent agenda as presented.
And do I have a second?
I second.
All those in favor of approving consent agenda items A through H, please say aye.
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 Thank you, Mrs. O'Brien.
Any nays? Hearing none, the motion passes unanimously. So we are on 7A, approve addenda pre-approvals.
Make a motion that we approve approvals.
I second.
Any discussion? Okay, hearing none. All those in favor, please say aye.
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 Any opposed, please say nay.
Nay.
Okay, the motion passes 3-1. And then we have action item 7B, and I move that the, oops. I did mine.
Okay. I
recorded.
voted on something.
Okay, so for action item 7B, I move that the governing board approve a new superintendent contract for Dr. Curtis Finch to begin on July 1st, 2022 and end on June 30, 2025, and that the governing board adopt its own superintendent's performance pay plan to be included in the new contract as an alternative to the superintendent performance pay plan set forth in ARS 15-341.A.37.
Second?
I have a motion and a second. Is there discussion?
Yep.
Mrs. Fisher?
I would like to publicly express my concern that though statute requires that we have a public meeting for the purpose of deciding and discussing performance pay, if we are not going to follow Arizona revised statute at that whether by legal advice or not, the board is choosing to have not public or open meetings and then put it in a contract and vote on it, thereby binding future boards to be held to the desires of the individuals in this board because it's in a contract. Secondly, I just want to explain my vote. This is the third time we've been in a situation of which to vote for this specific type of a contract for Dr. Finch. In the two prior times, board members elected to go along to get along. I had been asked if I would go along to get along as well because it would show some kind of unity. But what it shows is a lack of standing for the values which I believe I must honor. I have extreme concerns about the disregard for the board as a whole from Dr. Finch. I have concerns about disregard for our community as displayed in prior board meetings. I have concerns about the return to extreme retaliation within the district since Dr. Finch has joined us, and for those reasons, I will vote no on accepting this contract.
Any other questions or comments from board members? So I want to say that every year, as long as I've been a board member, and that started in January of 2015, the board has voted on the superintendent's performance pay plan, and that was prior to Dr. Finch being with us. We've not changed that practice. We do as a district and a governing board develop our own performance pay plan as outlined it says we do that in the contract, and then we develop the goals together and bring them for approval in a public meeting. We did that this year, we did it last year, we did it the year before. So it is not true that we do not provide the public an opportunity to weigh in on the district's performance pay plan, or the superintendent's performance pay plan for the district. In addition, I believe that Dr. Finch was an extraordinary leader last year, along with his cabinet, in ensuring and working to ensure that our students were in school in person, the students that wanted to be in person, the families that chose to have their students in person, along with his cabinet. And I think that that happened at a time when many schools, especially here in the Metro Phoenix area, were closed for 3/4 to all of the school year. So in my opinion, he has complete regard for our community and what our community wants. Given the times right now, I'm pretty sure, based on my emails and social media, we're making everybody angry right now. So I don't know how we could do it much better or differently in these times when everything is so divisive and folks are not offering much grace. I also want to address, and only to say that I'm unaware of anybody that's asked, and I hope Mrs. Fisher is referring to community members, because in my past and being the governing board, we do not ask governing board members to go along to get along. I expect that each of our governing board members will evaluate the data and information and speak to community members or look at facts and do research so that they can make the decision that they believe is in the best decision or best interests of our community. So having said that, I will call for the vote. All those in favor of approving the superintendent's contract and performance pay as outlined in that contract, please say aye.
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 Aye. All those opposed, please say nay.
Nay.
The motion passes 3-1. All right, we will move on to item C and 7C. Do I have a motion?
I will make a motion.
Oh,
that
I move
way.
that the governing board provide the direction to Arizona School Board Association delegate regarding the 2022 political agenda items to vote on behalf of Deer Valley Unified School District.
Second.
All right. Mrs. Fisher, do you have specific items that you would like to address?
I do. Do you want me just to provide you which ones they are all at once, or do you want to go one at a time? It's not a lot of them.
How many are there? I think that'll determine.
There's 11 that were noted.
All right, I guess, can you start with the...
Okay, page 1, second to the last one, it says return desegregation funding to the primary tax levy. The concern regarding this one was and has been that by returning the desegregation funding to the primary tax levy, we are putting a debt on our community, specifically for a very limited amount of districts. Those districts would be Phoenix Union, Tucson, and then there, I think, a handful of smaller districts. But by putting it onto that primary tax levy, it does spread it statewide and therefore puts the debt onto our constituents.
Okay, the next one.
If you go to page 2, the first paragraph, the very last one, it says, give all districts the authority to provide affordable housing options to teachers. In the last couple of years, we've had several cases of fraud specifically from superintendents. I agree with the concern, and the individuals who I've spoke with as well feel that this is just kind of opening the door for our superintendents or our districts to become slumlords. It is done in rural communities, often because there is not a choice. Like Red Mesa, they have a housing that surrounds their school because the teachers otherwise would live like 80 miles away, which isn't the case in our local communities. Um, I would I would prefer, I guess the community didn't tell me what they would prefer. I would prefer that we have an option of paying our teachers a little better to have a better place, or finding other solutions to support our new and young teachers. But I don't think just opening the door to all districts is a good idea. If you go to the next paragraph, fifth one down, um, I do believe that we need local authority. However, as boards can be undermined by administration, there has to be some sort of checks and balance.
Sorry, can you read the item?
Oh,
I
sorry.
didn't see.
Maintain exclusive local authority over any measure that would propose to consolidate or unify any number of school districts into a larger district. So boards can be influenced by their administrations. And I don't know if how much the board has history with unification, but unification has been attempted multiple times across the local area. And when it comes down to it, a lot of times it ends up being, well, we don't want to because then we would have to merge our administration. The concern being is when you have a district that has 600 students and then has a full administration, and next door you have a district that has 1,000 students and a full administration, and then you have a district that has 3,500 students and a full administration, even with adjusting for their tax debts, it still is a logical path to look towards unification in those situations. And even though we don't want our hands tied, our legislature doesn't want their hands tied either, especially when it comes to bringing efficiency and additional funds that we could apply to our teachers. Not we per se, but the whole system. So the concern is that by pushing this, we're kind of tying the hands of our legislative body. And it's not in the best interest of the community that we're supposed to be representing, in my opinion. On this page, the last one, it says oppose any legislation that has as its intent to lessen or curtail the legal authority of local school boards, including their authority to approve or represent curriculum. This one, my concern is the wording in it. I believe that we still have to work with within the Department of Education, the curriculums that are, the standards that are set. And I really feel like this opens up school boards to potentially go rogue. And in school districts, we see that they tend to follow each other. And so when you bring in something concerning, I just think it removes those checks and balances where there still has to be some. We are not infallible, just as our legislative body or others are not infallible. Next page, top section, third to the last. Defend against efforts to chill the free speech rights of school employees. I believe our employees deserve free speech. I do. I have supported employees even as they are verbally trashing me, and I've still supported their free speech outside of a classroom. My concern is if we are trying to make it to where they can have their free speech with our children, you know, I'm sorry, but our children aren't here to be taught anybody's belief system or political or any of it. There can be political discussions when you're talking about the structure of politics in a civics class, but I have seen firsthand at districts where they are actually actively grooming children to have a specific political agenda. And that to me is concerning. The last one in that same paragraph, support policy that protects school district employees and students from discrimination based on sexual orientation and gender identity. This is already addressed at a federal level. They already have rights and protections. I don't believe that this is the purpose for our schools, and I don't think it's appropriate to put it in the school agenda of any type when it's already a federally addressed issue. The next paragraph, second one down, repeal any program that gives public funds for private schools, vouchers, empowerment scholarship accounts, private school subsidies, student tuition organizations, and prevents any future expansion. The concern with that, and it was shared both, I share with the public that came to me with this one. I share their belief that we as a governing body, and it is, ASBA is supposed to be all governing boards for school districts. We are to represent our public in make sure that there's oversight for their tax dollars and what we're doing. And our first and most important thought should be what's best for the kids. And in some situations, an ESA is best for the children. In some situations, being able to have a student tuition organization is what's best for the students. I find it concerning that a school boards association would seek to undermine any form of education for a child. And that's kind of what the individuals who brought that to me also shared. The last one on that page, it says enforce financial requirements and seek recovery of improperly received and/or expended public funds by charter and private schools and organizations. I'm not opposed to them having to pay back if they are found to have those, if they need to recover. However, I expect the same in our public organizations and our districts. We have had multiple superintendents in the last couple years who have been prosecuted for fraud, who they have profited from. We have had board members over the last 10 years that have profited. We have had, employees that have profited off their position. And there is not a stance that they have to pay it back. I want it to be all of them, including public, charter, private. A parent with an ESA, if you spend it and blew it in an inappropriate way, you have to pay it back. I think these are tax dollars for kids' educations. And in law, there already is there is law that says that they can lose their retirement if they were to commit fraud against, but that's never enacted. And that's part of the problem, is that just because you can doesn't mean it is. So I would like to see in there that it's the recovery is from all, not just the charters and the private schools or or any organizations. I think it needs to include districts. And then the very last one is the very last page. There's only really one line. It says, oppose any measure that would result in fewer qualified voters from being easily able to vote or register to vote. Now we start getting into deep politics. There is the argument between whether you're Democrat or Republican, whether or not having election laws are intended to undermine the voter. And then on the other end, there is the integrity of the vote. You know, there's a movement for one day, one vote. There's a movement for a lot of things. And At the end of the day, that is not the business of a school board. That is the business of our elections office and of our legislature and of our, but we need to focus on schools. And trying to push a Democrat or a Republican stance on election integrity is really not the place of a school board or a school boards association to lobby against or for. So those are the list I have. That last one, I actually had several individuals within our local LDs bring that one to me. It was very concerning to them.
Mrs. Reed, did you have any? Or would you like to comment on any that Mrs. Fisher brought up?
Can you give me, I was trying to take notes really quickly. Can you come back around to me?
Yes, ma'am.
Thank you.
Mrs. Ordway? You're not, okay. Then I have a few comments. So for the desegregation money, I do agree with Mrs. Fisher because of the way those are set up. There's not really any incentive to get off of receiving that money, and so I would concur with her on her. I'm going to number hers 1 through however many she has, because that will make it easier. 9, yes. Okay. So for discussion purposes, I will put that out there.
Could we maybe go line by line with hers?
Yes, ma'am, we
and
can.
take care of this, and then if anybody else has other things to bring up, then they can bring that up.
We can.
Is that
Okay.
fair?
Do you have comments, Mrs. Reed, on number 1?
I would agree with that one as well.
Mrs. Ordway?
And I will agree on that. The reason for the agreement is that those, originally when DSEG funds were there, it was for a specific reason. Tucson Unified School District started it, look the history up, and you'll see that those funds are now not being used for desegregation. However, the funds are necessary and should be relabeled if that's what the legislature wants to do with those funds. So if we want to relabel them, that's to be more in line with what they do, that would be great. Because if we really were to look at what the original guidelines for the desegregation funds were, we have plenty of schools in Deer Valley that would qualify for it in an opposite way. So call the funds what they need to be called. Do not call them DSEG funds.
I guess I would agree that they're, I'm not saying that those schools don't need, or those districts don't need those funds, but given how they are, they should be appropriated in a different way. Mrs. Reed? Oh, you already agreed. I apologize. So on this one, the board would direct Mrs. Reed to vote no on this one. Okay? Is that, if we go through the line item and then we can vote at the end, Mrs. Fisher, and we'll see how it is down there. Okay.
I think we all know that when you get down there, it becomes fluid, and so long as she understands what it is we're talking about, she'll make the best decision based on that input, I believe.
So then let me back up before we can proceed through your list, so we can make sure our delegate understands, Mrs. Reed. At the end of the vote, it will be for her to vote to represent us. If, as we go through this list, 3 of us have a different opinion from one of us, she would vote as the majority of the board.
Correct.
To represent them. Okay, just for clarification, but we're going to go through your list and then see if anybody else has for clarification. Perfect. Affordable housing options was number 2 on the list.
This is something that is that I'm passionate about, because I sit on the homelessness task force committee for the city of Phoenix, and I know how short we are affordable housing and just housing options in general. And with the cost for rent in our district, it's considerably high, and we're looking at places in our district that are for a rent for a 1 or 2 bedroom apartment is more than a mortgage of a house. And if we're going to want to attract quality teachers to live in our district and work in our district, I think that we will at some point have to get creative. I don't know that there is a huge vetted plan in place for superintendents or school districts to be able to offer affordable housing, but I think that there is a conversation that needs to happen and guidelines to be put into place to be able to begin the conversation and to see if it's something that that would work for our district and that our community would be open to having. Obviously, I don't want to be in the rental business. I don't think that that the school board should be in the rental business, but I think that we do need to start thinking a little creatively and outside of the box if we want to continue to find teachers.
Mrs. Ordway?
I agree.
I also concur that this is a concern. I do think that we don't have a roadmap yet for it, but I do think it's something we should entertain. No longer is it just about how far you might live from your district. It really is, can you even afford to live in a nearby area, so I guess it is about how far. I mean, before it's maybe there's no housing available because you're in a rural community. Now it may be housing's not available because you live in an incredibly expensive area. So I do think we should pursue this path and obviously have some rules and guidelines. I don't want to be in the rental business, but it doesn't mean I don't want to be creative in looking at opportunities that will keep us bringing teachers to our district. We'll move on to number 3, which was the local authority to consolidate and unify districts. Yes, there's been a long history in Arizona surrounding trying to either consolidate or unify districts. I understand that the legislators do not want their hands tied. However, I also think that communities should have a voice in what happens to their school districts and their communities, their children. I'm actually, I don't know, I understand the concern about administrators, being worried about consolidation. I think there's also governing board members that are worried about consolidation in those situations because that's what happens. You go from 2 boards of 5 members that now you would be 1 board of 5, but ultimately I do believe that the community must have a say in that as well.
Just to that point, that brings up additional concern because we have some of the majority of our very, very small districts are in heavily Democrat or heavily, they're in heavily Democrat locations, which in theory, then we are driving a greater influence using public schools towards one political agenda by not consolidating. Instead of having one voice for 40,000 students, you have 40 voices for those 40,000 students. And then in the more, it's kind of like redistricting for our legislative districts. So that, I do thank you for the comment because that actually, in my mind, drives a even greater thought in why it's a concern that the school boards would fight against consolidation.
Well, without actually looking at the data based on political affiliation, I'm not sure that that is the case. I do know that we have far more school districts in our rural communities, and so you could have a district that is a small district with a few hundred students sitting next to another small district that's a few hundred students, but it is a wide geographic area. And so then you're talking about students traveling. And so while I do understand where you're going with the thoughts, but I would, without having the data, I don't know that we should say that we are, by supporting this, that we're driving students or allowing more Democrats to be represented by Democrat school boards.
I'm just going off of redistricting data for our legislative districts. That's all I can say. I can only give my piece.
Right. I'm just saying from a school district perspective, I don't know that that's necessarily accurate. And since we don't have that data, I just would be leery of saying that.
I was just going to say that we do have some very small school districts where the superintendent is the bus driver and quite a few, just quite a few jobs. So I think that when you have rural communities that are 100 to 200 miles away, that we don't want to consolidate that. And we do know that when we leave things totally in the hands of the legislators, they don't always do what would be best for a specific community. So I think that the closer the local government is to the community, the better they will be served.
Mrs. Reed?
Well, I would say from outside looking in that there are quite a few smaller school districts that might be inner city that probably could or should be unified in different ways to help the continuation of learning. So as you get to the high school level, that students are using the same curriculum. I don't think that it's my place as a governing board member in a different district to tell them that they need to unify. I think that that's that would be up to the communities in which they serve. So I feel like that, again, it's more local control. But to Mrs. Fisher's argument, being fiscally responsible, it's very expensive to run a school district. And so, it definitely would save money being able to unify some of those districts. However, I don't think that Deer Valley wants to get any bigger by unifying with any other districts. So
Yes, fortunately, Deer Valley is not near any other small districts. And
We're not
I
near them.
would say that
I'll take them all.
yeah, there are, I think, opportunities that would be cost saving in our suburban and urban areas. I do know that it's also complicated by bonds and overrides and how those taxes would be done. So we'll move on to number 4, local control related to curriculum. Mrs. Ordway or Mrs. Reed?
I think that, and I can only speak with how we vet our curriculum, that our community has a pretty good pulse on the curriculum that we offer and how we choose our curriculum, and has a very broad opportunity to have their say through appropriate standard channels, let's say, and then through off the cuff, I have a concern channels as well. I do think that it's important that we follow ADE guidelines when we look at curriculum, but I also think that it's important that we maintain local control and to be able to provide resources that are relevant to our community and what our community is asking for.
Go ahead, Mrs.
I
Ordway.
agree with you.
Okay, and I would concur as well. Item 5 on Mrs. Fisher's list is the chilling of free speech rights of employees. I don't believe this is about providing the opportunity for employees to say whatever they want in the classroom or to indoctrinate students to their way of political beliefs. My recollection of this is their free speech during their free time at a time. There were some consequences because legislators were angry that, if I recall correctly, teachers ended up taking some time off and going down to the legislature during their workday. So to the best of my understanding, this is about their free speech rights outside of the classroom when they're off the clock. Having said that, if Mrs. Reed, you get there and you find out that this is referring to in the classroom, I would not, I would concur with Mrs. Fisher's concerns. Our teachers are here to teach our standards and our curriculum, and they should be presenting both sides, and I believe our teachers do that in Deer Valley. So that is how I would fall on that issue.
Was that particular to teachers, or was it
It
all
was all
employees?
employees. It's all employees.
I'm sorry,
yeah.
all employees. Yeah.
And I would agree if she gets there and finds out that it is on their own time. They should, of course, they should have their freedom of speech on their own time without any, even if it's vacation time. They took vacation time to go. It's still their time. So
Right, that's the instance that I recall that this came out of, but there could be more, and certainly Mrs. Reed can find that out. Thank you for clarifying that, Mrs. Ordway. The next one, sorry, number 6 is, sorry, I didn't take very good notes on my paper on that one.
Support policy that protects employees against discrimination, against sexual identification or gender identity.
Oh, sorry, support policy that protects school district employees and students from discrimination based on sexual orientation
So that was
and
the
gender
concern, is
identity.
that this is supposed to be a legislative, this is our legislative agenda,
Mhm.
and it's already addressed in federal law. We're talking about policy. So that's, to me, it just doesn't even fit in this.
Can I
That was.
can I ask Mrs. Moffett, is there anything that you want to add, since that's more of an HR thing in your wheelhouse?
President O'Brien, Ms. Fisher, I would agree that that is covered federally. It doesn't stop institutions, though, then from forming their own regulations or policies around it, including school districts. So I don't think it's unique that they want to address it, but it is addressed federally, and we are obliged to follow it because it is in federal law.
But I would say that, based on what you find out, I would trust your judgment based on our discussion.
And I think either way, all it would be is a duplication of a federal law. So if it's put in, the wording is put in twice, it doesn't affect anything that we've already been doing. Correct, Ms. Moffitt? Yeah? All right, that's my thought process.
Number 7 is repeal. I think this is about ESAs and private school subsidies. Sorry, I didn't write all the words out, so. Repeal any program that gives public funds for private schools, vouchers, which are empowerment scholarship accounts, and private school subsidies, student tuition organizations, and prevent any future expansion. I have always believed that we have these options. Arizona has been at the forefront of school choice. I do not believe that our fight is in repealing them. I do believe we should not be expanding them. So that is where I fall for that one.
I agree. I am in full support of ESAs for special education because I don't believe that that all public schools or public school districts have the necessary tools to meet all of the students' needs at all times. But I agree with Mrs. O'Brien that I do not wish to see them ESAs be expanded any further than they are.
I wish they had written that a little bit less vague. To me, it's vague. I mean, it doesn't specify, and maybe it's assumed that we know that it is supposed to be, or was started and supposed to be for what special ed needs we cannot provide within a traditional public school system. So I would agree with it because I don't want to see it expanded. I want to see the students where they need to be, but I don't want the money drained from the traditional public schools that prevents us from providing those great services.
Okay, number 8. Enforce financial requirements and seek recovery of improperly received and/or expended public funds by charter and private schools and organizations. And going to, I don't know if it's Mrs. Mock or Mr. Miglerino that I could potentially put on the spot. Are there already statutes if there are funds misspent from our public school districts that would require reimbursement or recovery of those improperly received funds?
President O'Brien, yes, there are. And I think Ms. Fisher actually referenced one of the statutes regarding the loss of retirement is one example.
Okay, so these would be in addition to that, I would presume, and I don't know why we wouldn't.
Well, my
Wouldn't
concern-
charter schools fall under the public school one? Sorry, Mr. Miglerino, if you know.
They do.
President O'Brien, I'm not really familiar with what this particular legislative action is in regards to, but what's been reported in the media has been that there are parent companies of the charter schools that actually have arrangements with the to privatize some of the funds. So I'm not sure.
Okay.
I'm not that familiar with this to know if they are trying to get after some of those improprieties, but that has been something that's been reported in the media.
Thank you for the additional clarification. Mrs. Ordway? Did you?
Anything that would require a tightening of spending or misspending actually would be awesome. I believe that traditional public schools have a lot of rules that we follow, a lot of things that we have to turn in. I mean, Ms. Mock, Mr. Miglerino, are we lacking anything for tracking down every penny? I mean, even to say a high school bookstore, I mean, we know where the stuff is, yes?
President O'Brien, Mrs. Ordway, yes, we do. And I think a lot of that tracking and ability really depends on sometimes the size of your district. I think that in Deer Valley, we are actually lucky that we are a larger district because we have a lot of separation of duties. And so we've got eyes at the school level, P-card statements, deposits, purchase orders, invoices are all seen by multiple departments. And we have good communication with the Auditor General is required as well if we see any type of theft within the district. So we already have that partnership. I call it a partnership, but it's required by law that if we identify any theft that we work with them directly as well.
So maybe a better question is, now that you said that, and I don't know if either of you know, anybody in here knows that, are the audits that we go through, like all of the audits, required by the other, by the charter and the private school also? Whatever was listed in that, the schools that were listed in that, are they required like the traditional public schools?
Charter schools do not have all of the same reporting requirements that school districts have, or the same monitoring. And I think what Mr. Miglerino was referring to as well is that sometimes charter schools, it has been reported that charter schools would receive the public funds, transfer them to a private management company, and then those public funds virtually disappear within that private organization as well.
And also, correct me if I'm wrong, and then I'll be quiet, but I think that on the boards of charter schools, it can be relatives, and then they can also have relatives that are in charge of whatever they're in charge of, unlike traditional public school?
Mrs. Ordway, President O'Brien, that is correct, although I do believe that charter boards are limited to no more than 2 family members at this time. It didn't used to be limited, so there has been a little bit more control placed on those boards. But yes, the management company can hire relatives as well within the school, or family members can sit on the board.
I would like to see that go forward if possible.
Right. I just want to point out that we also have governing board members in districts that have family members within their districts.
Oh, I don't think the
And so
governing
it's
board
not-
members
it's
are
not-
CFOs, though.
It's not really different. No, they also have audits. I'm not going to get into defending charters, but what I am going to say is they do have audits. They may not have all the same reporting because they don't have all the same funds. The point is it needs to be an accountability for all, not just for some.
I wrote a 10-page white paper on this. It's on my website, on the
We've read it.
superintendent's report, charter school report. Go and read it, as all those points.
I don't agree with it, but I have read it.
Okay,
Just the
so
facts.
I think that I trust Mrs. Reed to evaluate this and understand it better when she gets there, but I think any legislation that helps to enforce the proper spending of our taxpayer dollars is important. And last but not least, impose any measure that would result in fewer qualified voters from being easily able to vote or register to vote. Mrs. Ordway?
I have no idea what that means, and I'm against it. It
Okay.
is so not clear.
Okay. Mrs. Reed?
I think that I would agree with Mrs. Fisher. It's outside the scope of what a governing board should do.
All right. Well, majority of the board has spoken. Are there any other members with items they wish to discuss?
Mine were covered.
You what? Yours were covered?
We're covered.
Mrs. Ordway, did you have any? Great. Thank you, Mrs. Fisher, for apparently covering all and then some.
Thanks to the public that sent in their comments.
All right, we are now going, oh, no, we have to vote on that one. Sorry. So the motion is that the governing board provide the direction to our delegate, Mrs. Reed, regarding political agenda, the 2022 political agenda on behalf of voting. And for the rest of them, you will use your best judgment as well as the ones we've discussed. All those in favor say aye.
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 Any opposed, say nay. Having heard none, the motion passes unanimously. With that, we will go to preview item 8A, which is K-12 Visual Arts Curriculum Adoption. And for that, we are going to go to Dr. Gail Galligan. And thank you all for sticking with us on this very late night and staying awake. And Mrs. Backstrom, it looks like.
President O'Brien, members of the board, Dr. Finch, tonight, Mrs. Anna Backstrom, our Fine Arts and Health CIS, and I will share a preview of the adoption team's recommendation for K-12 visual arts adoption. Anna?
Good evening. There we go. All right. Good evening, President O'Brien, Superintendent Finch, and members of the board. Our committee was made up of an administrator, teachers, and parents across the district that represented the possible stakeholders' perspectives. There has been a need for a current and regularly updated curricular material resource that aligns to the Arizona Visual Arts standards, along with our shift for standards-based grading and instructional practice. The team completed a thorough evaluation of the material submitted by the various vendors, looking at the alignment to Arizona's standards, as well as the supporting of curricular planning, instruction, assessment, and professional development. We have found a vendor that meets all of our district needs, including mixed medias for kindergarten through 12th grade art courses. In October, we will submit and materials order with little turnover time due to this resource being a web-based vendor. Professional development is included in this order, and we will be able to have it say self-paced or planned for use during district professional development. And these opportunities are on-demand resources that are grouped into small chunks for focused and timely implementation. These are some of the topics teachers will be able to receive a high level of professional development training within. The school success manager's primary role is to drive meaningful adoption and alignment of the Flex curriculum and Pro learning platforms to strategic and/or instructional plans. The school success manager works with system-level administrators to generate interest, encourage participation, troubleshoot implementation, and maintain proactive and consistent communication, documentation, reports, and support for the duration of the project. Additionally, the school success manager consults with leadership teams to execute their unique curricular framework and professional learning plan, particularly as it aligns with instructional practices, curricular goals, and strategic initiatives. The Art of Education website provides instant access to general technical support. For more complex issues, the school success manager will provide technical support around all digital resources, either by phone or email. Typical response time is within 1 business day or less from the initial contact. Support includes, but not limited to, service problems, product setup, upgrades, and troubleshooting.
We believe that the resource presented meets the arts standards for grades K-12 within mixed media courses. These resources integrate digital and hands-on components that students and teachers will utilize throughout the next 7 years. The K-12 visual arts adoption, including tax and shipping, will be $216,802.96 and is within the budgeted amount for curricular adoptions in the 21-22 school year. In summary, together, Flex and Pro from the Art of Education will ensure our art teachers have what they need and also know how to teach quality art education to fulfill our district's guaranteed and viable curriculum with materials aligned to the Arizona Visual Arts Standards. We will bring this topic back to you as an action item at the September 14th board meeting. Thank you.
Thank you so much, Dr. Galligan. Mrs. Backstrom, are there any questions right now?
Did you receive any public comments?
President O'Brien, Ms. Reed, we did receive some public comments from parents and parents and teachers. They were all very positive and in favor of the Art of Education. The one concern that a parent did mention was that they were afraid that it might not align to the Arizona state standard for visual arts. However, that was only because in our Sandbox account, it is a generalized version of the standards that you can research. So it only aligns to the national visual arts standards and not, you're not able to delegate the Arizona standards specifically. But in the full implementation process, we as a district will have access to filter and search by all of the Arizona state standards for any and every lesson, whether we're doing PLC work or professional development.
Thank you.
Ms. Fisher? Okay, Mrs. Ordway?
I would just say anything I have, I'll email because it's, 10:30 and I love you guys.
Thank you both. Appreciate your presentation. We have items 8B through G, our first readings of policies. And who's doing these?
First couple are my section, first 4, I believe. And again, this is first reading, so if you have any questions, you can let us know. These are all recommendations from ASBA. And obviously impacted by the legislature. So this is why we're running through our changes. We'll have a lot coming through over the next couple months. But BDF is talking about advisory committees. And the summary written here is policy BDF is for advisory committees is amended to make clear that if a board creates an advisory committee or directs that the committee be created or appointed, appoints members to the committee, that the committee has the authority to act for the board or make recommendations to the board. The committee is covered by an advisory committee or a subcommittee of the public body under the open meetings law. That's BDF. And you have the attachments on the changes that they've had. Yep.
Haven't they already been held subject to that, that longstanding? Have we just not been applying it and they're putting it in policy?
Yeah, it's a new change in language from I believe the legislature caused this one. It's just a reminder. Actually, a lot of these are.
I thought, yeah, that's what I'm saying. I thought it was already in law for many years.
Yeah, they're just codifying. It might be the right word.
I think they're updating the policies to include this one, maybe.
Yep.
I don't know.
Same with BEDD, same concept here. It makes it clearer, or makes it clear that the governing board president has the authority to recess a meeting without a vote of the governing board to maintain decorum and follow the rules of order. So that one's, again, something you can already do, but just, again, making it a little more clear. BEDH, that's public participation. This one is amended to prohibit unsolicited commercial messages during the call of the public, like today. So that's a good example. Policy BIB, that's under board member development. Again, this is legislative. This came out of House Bill 20906. Well, you have the reading there in front. I won't read it all. Basically, we can't expend funds as board members for training, orientation, or therapy that presents any form of blame or judgment, race, ethnicity, or sex. This does not preclude any, obviously, training on sexual harassment. So that is the 4 that are coming out of our office. Again, this first reading. If you have any concerns, we can run it to our legal counsel. Is that mine?
Okay. Do we have any questions on those first few?
I have some concerns, but I'll bring them back because I need to logically think through them a little better.
Yeah, if you can email me or whatever, if we need to check with legal counsel, I can do that.
Okay. Policy EEA. Wow. I hope I don't have to say that fast. And who will be covering that would be Mr. Miglerino.
President O'Brien, members of the board, Dr. Finch, we are recommending not to adopt the ASBA policy advisory. The law did change, House Bill 2159, that allows for, I'm going to call it reciprocity with CDL certification for those districts that would be adjacent to another state. Since I'm not predicting that we will be adjacent to another state anytime soon, I'm recommending that we don't adopt the recommendation, although we would have that option if we were adjacent to another state at some point in time in the future.
Could be adjacent to another country if we're not careful. Which one is that one?
I guess, I'm sorry, Dr. Finch, I have a question. Dr. Finch, Mrs. Taylor. So we have the presentation that has multiple
attachments.
They're not necessarily here.
But they're not all listed on our agenda.
That's why I was trying to find out.
We're not recommending this one, so we just FYI for you. And that's
Okay,
like in
then
Seattle, they formed their own country in the middle of.
Okay.
That would be, we could get bus drivers from them.
So now we have, all right, JFABD, admission of homeless students. That looks like it's going to be Dr. Zerbach.
Yes, it is. Thank you very much. So this one is similar to the first one. One of the, someone had said, is this something that is already being done and it's just being codified in policy? So this is an example of that. Just one line has been deleted that is in reference to students in foster care because it is now contained in its own policy, which is JFABDA, which is the next one.
Okay.
This one as well, what is contained in here is something that we already do because it is a requirement in the Every Student Succeeds Act, and it has to do with preference of school for students who are in foster care. Again, it is something that we already do, so we will be recommending accept ASBA's language for both of them.
Okay.
I have one question.
Yes, ma'am.
One of the biggest problems with McKinney-Vento is the transportation component. And I know it's generally when you have a couple that splits and, you know, mom stays here, dad moves to Scottsdale, and suddenly we're sending a white fleet to Scottsdale. Does any of this have an impact on things of that nature as far as transportation? And what are our protections in the law? I mean, I don't want to have, not that I don't want the child, but I don't want to have to drive to Tempe to pick up a student who decides that they just want to put them here. Do you know what I'm saying?
Yes, President O'Brien, Ms. Fisher, there are some implications with as it deals to our students in foster care, and they are afforded the right to their school of origin through this particular policy. And again, it is something that we are doing because of the requirement in ESSA.
Okay, so we'll still basically be sending transportation pretty far, or potentially could be. And
If they were a homeless student, right?
well, but see, the problem is with McKinney
foster care.
is if me and my husband were say were to divorce and I had a school-age child, and I go to live in Tempe with my mother, I am considered a displaced individual, and so by definition, me and my child are homeless. So if I choose to keep them in Deer Valley, then it would qualify to force the district to send a white fleet or a bus or something
Sure.
across town to bring it. And it's just becomes very problematic as far as expense. But I just didn't know if there was any, it's also not good for the kid, to be perfectly honest. That's, you know, who spends an hour and a half in a bus across.
But it's federal law, so.
Right, unfortunately, right.
But it's still in the law.
Right.
So nothing's really changed with that
Okay.
in this, correct?
Nope.
Okay.
They're just codifying, continuing to codify. All right. Is that all?
Yep.
Wonderful. Thank you for that presentation. Governing board reports. Mrs. Fisher?
I'm going to try and keep it shorter, even though I have a long list, but I'm going to keep them somewhat shorter. One of the things that remains concerning, and as we all saw from this past week, is the division of communities. And I don't know how we can unify them, but we need to try and do something. All of us received a lot of emails, and in those emails were things like, we've got to mask up, we can't let those anti-maskers win, and we can't. And on the other side, the other parents weren't talking about masks at all. They were talking about quarantines. And so, and I don't know what we can do to do that, but I still want to keep it in the forefront of the agenda that we need to find a way to start unifying our communities as well as our district. One of the concerns that was brought, I believe to all of us, but I also received a lot of messages, was regarding cleaning protocols specifically at Union Park. I don't know, I assume we have very good cleaning protocols and products and whatnot, so I don't know if that's something that the district just needs to look at. But I did receive several concerns that cleaning protocols weren't being done appropriately, and so it was a potential danger for COVID or other disease. I received, maybe we all did, information that really didn't make sense, that we have an empty classroom at Vista Peak. So I don't know if y'all can just provide us with some information. Do we have empty classrooms at Vista Peak? Do we have, do we need to do something to figure out what's going on? Is there space that we maybe need to get some students in? Or otherwise utilize those facilities for our students? Another concern I received is regarding, and again, I think this came from social media, is there are teachers that have expressed their intent on during October 14th and 15th, they will be celebrating Black Lives Matter days, correlates with the, would have to be the birth date of the gentleman who died, the black gentleman that died. I don't know why I'm drawing a blank on his name. George Floyd.
George Floyd.
Correct. So they were concerned that that would be brought to our district. So I'm just making curriculum instruction, Dr. Zarbach, whoever, aware that that is a community concern. That will those Black Lives Matter days be brought to our classrooms? I have received multiple, a lot, concerns from employees about retaliatory practices within our district increasing. It has come from both classified and certified staff. It has come from several teachers, which really surprised me, that they're facing retaliatory, some of them for something that even they didn't even have a part of, but they're suddenly faced with a punishment because they were somehow linked to something someone else did. I've kind of really talked through with some of these, and specifically the teachers, and said, you know, I can't necessarily address something if I can't say your name, but at the same time, they're afraid. They're afraid to lose their job. They're afraid to be next. They're afraid to speak up. So I don't know what you can discuss in cabinet or how you can discuss it or what you can review or, but these are what I've heard over the last month are things that I have not heard since 2014. And I thought that we had really changed the atmosphere within the district. And so I just, I will tell you, one of them told me some stories that were so horrendous. I sat there and I cried with her. Because no employee should have to face that. And no employee should have to say, you know, I'm this close to retirement. I just have to shut my mouth for the next X years. Especially when they've been here so long that there's families that love them. So whatever you guys need to discuss in cabinet, please do. It should not be something that we hear from our district. And then the final thing is I would like to know, and I would really prefer it not be in a board update because a lot of community members had asked me about this, and it would be like a 2-second blurb in a meeting. But I think it's really important if we know, or if you could even share with me the process for establishing a club or and I'm assuming it would be Mrs. Mock or Mr. Miclarino, establishing a club, what our criteria is. Are they required to be a 501c3 or not? Is there a limitation? X clubs are not allowed, X clubs are allowed, kind of. And I know what my process was at Phoenix Union, and I know that there are some clubs that technically aren't allowed, but there is a way students can do them. So I would just really like to have something so that our community can know what our process is, especially when a lot of times they don't understand clubs. What brought this up is there was several fundraisers, which are great for kids. And I saw a lot of how dare the district ask us for more money this way. And it's like, whoa. That's not the district asking you for money. They get none of it. This goes to these kids. It is their money. It's student money. It's a pass-through. We are fiduciaries of it and whatnot. But I think it's really important that our community understands our clubs, our students. We're simply a fiduciary. but also that they understand that what our process is on approving our clubs. And that's all I have.
Thank you, Mrs. Fisher. Mrs. Reed?
Thank you. I'm going to keep this really short too. I just want to say that I appreciate everything that our school nurses and our staff and our teachers and administrators and district staff have been doing, and kitchen work, food service workers and bus drivers and custodial staff to keep kids in school for the last 4-ish weeks. I know that it's been really challenging, and you've had to go above and beyond your scope of duties and pitch in places you probably never thought you would have to help. And I'm so thankful that you have been doing that. I am concerned about just the fatigue for our staff. And not being able to have their prep time and having so many students out on quarantine, and then having to make sure that students are back up to speed when they do come back to school. And I know that we discussed not being able to Zoom and teach virtual school and in-person school at the same time. And my ask is that as we continue down this road, that we just consistently reevaluate that practice, because I just think that if I was a classroom teacher and I had 15 students out and 10 students in class, it might just be easier to turn the camera on and get everyone up to speed at the same time. And so what I would like to see is a conversation that teachers, if they decide that that is the easiest way for them to be able to communicate with their students, that they would be able to have that conversation with their principal and be able to do that, or to record that lesson and disseminate it through Canvas. I know that my kids missed 3 days of school because we moved Seth to Iowa for college. And when I was trying to get on Canvas and help them, not all of the information was readily available. And so it was a little challenging. And I think that some of our teachers are still cleaning up some of their Canvas from last year and removing things that didn't work. I don't think that anybody anticipated that we would have this significant amount of COVID spread and quarantines at the beginning of the school year. So if we need to reevaluate some of those processes to help accommodate our teachers and our students to be mutually successful, I would like to see that happen. And just, Mrs. Fisher mentioned it, we did receive a lot of emails, and I did read every email that was sent over the last 2 weeks regarding quarantines and masks and policy and all of that. And I do just want to make a couple of things clear, and that we are elected officials, we aren't paid, we don't have assistants that help us formulate our email replies. And when I do try to reply to an email that's a thank you so much, I read your email, I wanted to let you know, I do get some nasty emails back saying, oh my gosh, you don't even have the time to send me, and answer all of my questions. And sometimes there's, dozens of questions that are in the emails. And I still have a full-time job, and, I'm in it, I'm in the trenches with you with trying to get my kids in school and keep them in school and help them get their homework done and support their teachers and our school staff. So I'm just asking for a little bit of grace when we do try to reply back, just to know that, I didn't even count how many hundreds of emails we got, but we got several hundred emails. In some of the emails, it talks about, that I'm making masks political, or that the board's making masks political, or quarantines political. I don't have any desire to make any of this political. It's not my intent to run for office again. I'm not a political person in this. I'm a mom that's trying to do the best thing that I can for the district for the 4 years of service that I have. And knowing that any of the policies that I pass directly affect my kids first and foremost. So when I walk home into the door tonight,
I have to look each of them in the eye, and you know, I'm held accountable to my children first. So when I pass policy or make a comment up here, you know, I'm definitely wearing my mom hat as well. Um, both sides of the argument have very valid points. You know, and I see both sides very clearly, which I think is a curse of sometimes of being in the middle and being able to put on multiple lenses at the same time. Both sides have very valid valid arguments, but the one thing that, you know, I think that we're forgetting is that it doesn't matter how loud you shout. It doesn't matter how strong of a belief you have. We're not changing the minds of the people who think differently than you. And so what we need to try and start to do is to figure out what the common denominator is. And the common denominator is we all want our schools open and we want our kids in in-person school. We may differ on how we think that we need to keep our schools open and how we need to keep our kids in seats in in-person school, but we have to come to an agreement that we want our schools to be open. We want our kids to learn, we want our teachers to be able to teach, we want everybody to be healthy and safe. So that's the forefront of it. And I'm hoping that once we can fully agree upon that, we can start to make some steps ahead to, like Mrs. Fisher said, to bring our community back together. I'm going to ask a big ask of parents. Our administrators and our teachers are trying to keep their students safe and their staff safe. Please don't scream and yell at them. They are not making the rules. They're the ones that are enforcing the rules that they may not always agree with 100%, but they're enforcing what the district and what the governing board and what the county and what the state and what the federal government has set forth. If you want to yell at people, you can yell at us because we're the elected officials. We've got big shoulders and we can take it. But please don't take your anger out on your principals and on your teachers. Those are the people that are directly, related to your student and they're in your community. And I don't want to see those relationships severed or hurt because of a disagreement on how you feel about a mask or a quarantine policy. So I'll leave it at that. Just know that I am thinking about all of our staff and our teachers, our administrators. I appreciate everything that you're doing and thinking about all of our parents who are trying to help their kids keep their grades up and remain in quarantine. And I'm hoping that in another couple of weeks that this surge will be behind us and we can start to continue to move forward. Thank you.
Thank you, Mrs. Reed. Mrs. Ordway?
We've heard so much tonight about so many different things, which could describe any board meeting. However, this board meeting, we are sitting here amidst a variant of a virus that shut us down, and then we opened up, and we were successful. We learned how to socially distance. We learned how to respect health. We learned how to really want to be back. I watched the report. I watched the eyes in the report. I've heard from hundreds of people, whether they be staff, some of them even students, some of them community members, some of them just people that are doctors that are interested in students' health and their ability to, at some point in time, go back to something normal. So when we hear or read, CDC says indoor masking until numbers go down, until this variant has flattened, I take that very seriously because I think the longer we don't, the more people we have out, and the cycle just continues to go. So we do have regulations that can be put in effect that if numbers, again, I wish that Kip Schlom and Dr. Sonnenschein were here so we could not that Gary, you telling us this is not as important or effective, but to ask them some of the questions that you are going to have to ask them if I ask them now. Same. So I just wanted to be hopeful that if the numbers do go to a level that not only impacts health, but impacts our ability to have our campuses open and facilities open safely, that you, Dr. Finch, you have that regulation, and then we call an emergency meeting to have a vote. I do not want to let this go because it's too hot of a topic to discuss, and you have to be worried that you can't get a word out edgewise. So those are my thoughts on that. And of course, thank you to all the staff and parents and community members that have been totally responsible with your passionate beliefs on either side of a mask issue. So thank you very much.
Thank you, Mrs. Ordway. I am going to briefly touch on a couple of things I got to do just recently. One was to attend the Arizona K-12 Center Board of Directors meeting. And in addition to having the nationally board certified teacher program and Arizona Teacher Academy for teachers, on September 2nd, they're offering a providing powerful feedback and experience for administrators only, which is online. So if we have any administrators that are interested in that, they have that available. I think it's exciting to have that opportunity, especially since it's online. In addition, I was able to tour Phoenix's Burton Bar College Depot, and with the FAFSA opening up here in October, they have some incredible resources. And prior to COVID, you could only get those resources in person and that assistance and help. And because COVID forced them, like many of the rest of us, to pivot and figure out how to do business differently, there are now opportunities to get that help online. So while it would be not completely unfathomable, but certainly Burton Bar is a long distance from most of our Deer Valley schools, especially our high schools. Now that there's an online option, I hope that we could have our high school administrators share that information with the counselors and our families, because I have a college degree, but I'm going to tell you, doing the FAFSA for my 2 college students was more miserable than taking a college exam. And I know most of you in this room know what that feels like. And so I think any help we can offer to our students and their families, if they wish to pursue a college degree, we should be able to share, or we should be sharing that information. So those are going to be my 2 quick business items to share with you all. And once again, thank you for all you're doing to our families, our community members, our students, staff. Please stay strong, but show grace, and remember that we are in this together, and we can do it. We just need to be a little bit kinder to each other. So with that, I'm going to allow Dr. Finch to have his governing, or not his governing board report, his superintendent's report. Sorry, it's a little late. Yes.
I'll be brief too. Just again, thanks for the opportunity to lead Deer Valley. It's a great district as we march to number 1. We couldn't do it without our team. As you're seeing some of the top people sitting in front of you today, they're my right-hand people, help us make good decisions. We have great administrators, great staff, great teachers, all working together in the same mission to provide extraordinary education. So thanks to those folks too that are keeping the machine rolling. Ms. Ordway is correct. I want to reemphasize what she said. We do watch the numbers daily. Dr. Z and I visit on this topic every day, pretty much. And so we will be watching those numbers to see if they're flattening, raising, lowering, et cetera. And yes, Ms. Ordway is correct. The superintendent has the authority to do a regulation at any time, as I'm in charge of day-to-day. And the board, the second part of her statement is also correct. The board has the right to trump anything that I do by or calling for a meeting and trumping me or doing their own thing. They can do that as well. So it has been done in the last 2-3 years. Both avenues have been done. So stay tuned. We'll continue to take the feedback and hopefully make the best decision for all students. So thanks again for the opportunity.
And with that, I would,
Not want to talk about the following meeting dates?
I do want to say our future meeting dates are posted, but I would entertain a motion to adjourn at 10:59.
Well, with no sighing, I will make a motion to adjourn the meeting at 10:59.
Is there a second?
Second.
All those in favor, please say aye.
Pretty sure everyone says aye.
Any opposed? Motion passes unanimously.